will have an opportunity to engage with us, send their questions, and we can be able to answer them and do deep dives. But in addition to that, we have quite a lot of FAQs, brochures and things like those, and they are provided there in a shortened link that you have there, both for the tax and as well as for the different customs procedures. We've also given you the link for the National Investment Commission in case you want to go there and visit and see all the different opportunities that may be available there. So this is how you can get in touch with us. We are always available. We want to stop there and see if there are questions, then we can take those questions as we proceed. That will be the end of our presentation. Thank you so much for the opportunity. We look forward to the opportunity and time to answer some questions.
Commissioner Jala has put me in a very hard zone, but I don't know. I will advise, technically I got 15 minutes left on my time. So I would advise if we can collate the questions, those that are online, we can collate these questions.
It's over to you. We're not getting any volume immediately.
All right, whoever on the tech side, can you please communicate? Just let him know. We will not go into questions, just in respect of the other panelists as well, but I would advise that we collate the questions because I saw some very important questions. And like I said, the Ambassador Dunn website is already live, so that post-conference, we can collate those responses and contact information for the right people at LRA, for example, that people can reach out to, just in the respect of time. I will beg your indulgence, Commissioner Della. I know you're ready for questions, but we'll do our best to make sure those questions get to you. Those of us who can buy 40 mattresses and say we're moving back. Commissioner Della said when you go in from Walmart, don't sell 40. Send it one you can sleep on. Don't go sell it and then get the money to chill. But anyway, that's just a side note. We'll go straight into a video. Commissioner Jala, I don't know if you can hear me. I was saying, given how far we've run over time, we were begging your indulgence that we will collate all of the questions. Some of them have already been posted online. There are too many. And send it to LRA so LRA can have better directions of responses or links that people can find the information rather than trying to go into the audience with questions. I see you nodding your head. Thank you, sir. Very much appreciated.
Most certainly, we hear you and we agree with that.
Thank you. So we will proceed. Do we have the next video ready? Ministry of Agriculture. I think my panel, the hardest panel. Is it ready?
Was that a question for us?
No. Commissioner, and I keep you in your office already till 8 o'clock. You can go. Great.
Under the National Agriculture Development Plan, the NADP, also known as the Liberians Feed Yourselves Agenda, the Ministry of Agriculture is delivering results, improved food security, job creation, and economic growth. Rice is priority 1. Our target is to cultivate 50 hectares of lowland rice by 2029. Already, over 4,000 hectares were developed in 2024, and more than 6,500 this year in Lofa, Nimba, and Bong, the nation's major rice-producing counties. Irrigation projects such as the Fagonda Dam in Kulahun, Lofa County, and the Bedi Dam in Nimba are securing all year-round water supply to rice fields. These efforts will boost rice production, thereby cutting rice imports by 70%.
So today, we are happy to be here to dedicate this land to what we have developed.
5 mechanization centers have been completed, and 8 more are in progress in 7 counties. By 2025, a total of 13 centers will be fully operational. The labor of farmers will reduce, yields will rise, making agriculture more attractive and profitable. To attract more youth to agriculture, modern farming equipment has been provided to higher learning institutions like the Tubman University in Maryland County. As a result, enrollment in agriculture has increased, setting the stage for Liberia's next generation of master farmers.
We have the tractor with the power tiller, the plow, and the rotavator. We are able to do a lot with that. Where we never had the machine, the equipment, our enrollment was dropping. But with the provision of the equipment, I see more enthusiastic students coming. Just recently when we did the entrance, a lot of students declared their intention, their interest in coming to the College of Agriculture.
Access to market has been a major challenge. Over 200 kilometers of farm-to-market roads in Bong, Lofa, and Nimba has been rehabilitated, and efforts are underway to complete a total of more than 500 kilometers by the end of 2025. With this development, farmers can transport their produce faster, reduce post-harvest losses, and easily link up with new buyers. As Liberia's second staple food, cassava is becoming a major industry with over 1,000 hectares already in production. These efforts are expanding plantations, modern processing, and better market connections, creating jobs for women and young people across the country. In Bible, Liberia's first ever national cocoa seed garden is flourishing in Nimba County with over 19,000 budded trees spread across 18 hectares. Meanwhile, 140 cocoa nurseries in Bong, Nimba, and Lofa are producing more than 25,000 seedlings each, supplying farmers who are planting hundreds of hectares with improved cocoa. With this, Liberia is on track to meet and possibly exceed its 10,000 hectare cocoa target under the NADP. Oil palm farming is expanding rapidly in Liberia, transforming communities and generating new economic opportunities. With modern processing plants, farmers are moving from small-scale operations to complete value chains. From plantations to mills, palm production is creating jobs and driving exports. For years, Liberia relied on imported eggs and chicken, but change is on the way. With private companies investing in the sector and government support of 50,000 broilers, drinkers, and feed, the country is now taking bold steps to.
For eggs, I can see the part. I now know that it's possible for us to ban the importation of eggs. It's possible to do that, given what I've seen, the investment I've seen.
The pig industry is rapidly expanding across Liberia. To support this growth, the ministry has distributed over 2,800 pigs and feed. These efforts are helping smallholder farmers diversify their income and build a stronger livestock sector for families. The Ministry of Agriculture is delivering results: rice, roads, cocoa, eggs, and innovation.
This is how we want to see agriculture in this country. We want to be able to introduce legalization. Because like the past, the president, he always says, women will never be part of agriculture effectively. We will continue to do the way we have done in the past. As you can see, what happened here, we were able to harvest the fresh 3 bags of rice in less than 10 minutes. If you have a company in this country, because the broker of the little will be reduced. And this will also increase our level of productivity and make us self-sufficient. Looking for you.
The agriculture minister making it possible. No small restaurant. We're going to make them big restaurant, right? They won't clap you like I'm not scared about the farm. Minister has extended the invitation, so no more excuses. Let's get to business. So we will have another video rolling, but while we do that, I would like to invite my panelists. It's going to be a rapid fire, and I mean rapid fire. We will breeze through as fast as we can. So without wasting your time, I would like to invite Ms. LIBERIA Diaspora from XE Place and Pour. And we'll line up that video as she's coming up. Just hold it there for me. Mr. Lester Cromer from D Calabash, are you in the room? Calabash is smarty. I hate to break your heart. You're not in the room yet, so let's see if he arrives. Sorry to break your heart, but one shot for D Calabash. I would also like to invite Lorenzo Barr from Liam Group. That's a rice importer. Lorenzo Barr. Rapid fire, let's speed it up. And then I would like to invite a representative from In Shelters. The real estate. Yes, yeah, apply for Calabash. Well, I'm apply for hospital. I'm just kidding, no money. I'm myself apply for Calabash. But there's a video we have. Is it ready? I'd like to open up with a video. Let's roll it.
Your Excellency President Joseph Nimwa Pwaka, Her Excellency the First Lady, Honorable Ministers, distinguished guests, ladies and gentlemen. It humbles me to stand before you today to testify not only my own journey, but also of the resilience of young entrepreneurs in Liberia. My name is Irene Yasakoli. I am a Liberian woman, a mother, and the keeper of my grandmother's legacy. After 9 years in Europe, I came home not to seek comfort, but to invest in the future of my country. Like many in the diaspora, I had heard the fears that returning home to invest often means facing obstacles, risks, and disappointments. But I chose faith over fear, and like so many others, I too was tested. With nearly 100,000 United States dollars, my family and I built E.S. Split and Pour, a restaurant named after my grandmother E, a woman whose spirit of kindness and hospitality shaped my life. On August 24, 2024, we proudly opened our doors, creating jobs and dignity for 16 young Liberians. But just 6 weeks later, on October 5, 2024, that dream was reduced to ashes. Our restaurant was burned in an act of arson. In one morning, our investment, our children's future, and our staff's hope went up in flames. We were left with a choice to surrender, to despair, or to rise again. By God's grace, and with the kindness of individuals who believed in us, we chose to rise. We rebuilt, and today, though everything remains a struggle, our doors are open once more. Our scars do not tell a story of defeat, but they tell a story of resilience, survival, and unshakable hope. But hope alone cannot rebuild Liberia. Vision must be met with support. That is why I stand before you today with a dream greater than restoration. We are working to expand ES into ES Luck Village, a hospitality destination combining restaurant and Airbnb. This is not only about food or rooms. It is about jobs, training, stability, dignity, and proving that Liberian dreams can thrive, not die. Mr. President, I once came quietly to your home seeking help. Today I stand publicly, not just for myself, but for every Liberian who risks their all to invest into this nation. With humility, I ask for your leadership. Let the truth breathe. Restore the suppressed reports and ensure that justice is not silenced by those in power. Let small businesses live. Establish protection and relief for Liberian entrepreneurs whose dreams are threatened by sabotage and injustice. and to my brothers and sisters in the diaspora, to investors and friends of Liberia. I know your fear. I lived in. But I also know your courage. When you invest in Liberia, you are not only building businesses, you are building futures, you are building dignity, and you are building a stronger nation. My name is Irene Yasakoli. I am a mother, a daughter, a grandmother, and the keeper of EA's legacy. I still believe in a Liberia where justice protects the weak, where leaders stand for the people, and where dreams are not destroyed, but rebuilt, restored, and blessed. With your support, we will not only rise from our ashes, we will soar higher than ever before. Thank you.
Thank you very much. So, thank you. Congratulations, Aaron. Thank you, as you can see. The room responds to goodness. Thank you. Thank you.
Thank you.
And to the organizers, you can't take it off my time. You gotta add it. It deserves this response, so we gotta give time for it. Quickly, I will go this way with our panelists. We will go around. You will have the opportunity to introduce yourself and respond to the questions, so they're not separate. You do all in one swoop. As we just heard a beautiful story, those of you who have come up here, you've taken up the courage not to just show your challenges, but to share with our brothers and sisters in the diaspora some of the things that you have experienced and some of the lessons that you have learned that will be extremely important for why they should invest in Liberia as you have done. So, Aaron, I'd like to start with you with a heartfelt video that you just shared, but with a happy ending. As someone building a business on the ground in Liberia, what practical challenges and opportunities do you see for diaspora investors who want to partner locally? And what support mechanisms could make those partnerships more effective? All of us cannot go to Liberia to do business, but how can we then partner to channel some of our resources to local businesses? What opportunities are there for people in the room today?
Well, first of all, my name is Irene Colley, and sorry, I'm going to be a little bit emotional.
That's okay.
Challenges are just too much. I was going home, I didn't tell anyone. I loaded a 40-feet container to Liberia without telling, not an extended family, not an immediate family, and no one I told. I loaded a 40-feet container and took to Liberia, and they were surprised to see me. Absolutely surprised. And they were afraid. Everyone afraid. But, well, I had a faith. And I didn't give up. I started a search for a place. The opportunities there is Liberians, young Liberians, with carry jobs, young Liberians. You will not believe when I put the vacancy up. You will not believe how many Liberians applied. Out of hundreds of applications, hundreds, I didn't say 10 or 15, hundreds, just for 16 positions. As you saw in the video, I employed 16 young Liberians. Those are opportunities. We train them in the hospitality sector because I love hospitality. As diaspora Liberians, we should go. Let's invest in Liberia. Liberia has a future. And with this president, His Excellency President Joseph Boakai, I know that Liberia has a brighter future for young people for diaspora Liberians.
Thank you, Aaron. I will come to you. I think I got you from In Shelters. What's your name, sir? Mr. Dan. So use the opportunity to introduce yourself. I will throw your question in that same breath. From the context of real estate, because I know that's where you guys are structured, if you had to name one practical step that can be taken within the next 12 months to advance organized diaspora investment in Liberia within the context of real estate, what would that be?
Thank you for inviting me here to be here with you. My name is Mr. Don, and I represent In Shelter, also known as Smart City in Liberia. I believe most of you have heard about that. The practical step that I believe will be good for us Liberians, especially those of us in the diaspora, one is to network with each other, to find out what it is that is good for our country, especially so since the president has sent out this challenge for us to come out and be of good help to Liberia in terms of development. One of the challenges that we face in Liberia, and I would like to ask this question, how many of you in this audience have never had, don't forget, have never had a problem of a land problem in Liberia in this audience? Okay, so that means...
We hear you, everybody.
Yeah, so that means every one of us, we have that same situation. This is where Smart City comes in to solve that problem. Because we will take on that responsibility of getting your land, building your home, a decent home, to invite quality Liberians back to Liberia. We don't just want to stay in this country and offer all our expertise, but our Liberians need us, and this is where we come in. Thank you.
Thank you. So, shortcut, don't get your uncle or your cousin to go buy the land in one corner. Find the professionals who can help you go through the proper channels. Because if your uncle or your cousin buy it, trouble come, you're on your own. Huh? I'll turn to you, sir, Mr. Barr, and I know you from the rice importation sector. I'm going to ask you a simple question about opportunity for investments, a variation of the question I asked earlier. Because there are thousands of Liberians who are not able to go to Liberia, but want to support businesses, but also want dividends for their dollars. So as someone in a much larger sector, the rice importation, and being one of the few Liberians that are actually in that sector, what real opportunities exist for facilitating Liberian diaspora investment that can yield actual dividends, but yet them meet your bottom line as a businessman?
Thank you for having me. Yes,
it's up to you, sir.
I'm a preacher, so I like to stand. First of all, I would like to say thanks to God for the opportunity to be able to be a rice importer to our nation. And on behalf of my wife and I, we want to extend our sincere thanks and appreciation to our dynamic president, Joseph Newman Boyka, for a sound decision to put Liberians to be part of the rice industry. And I just want us here this afternoon to give President Boyka a very big hand of a clap of applause to say thank you, President Boyka. Because I always say that President Boyka is the Moses of Liberia, because he's taking us through the Red Sea, and he's doing something different for us. The rice industry in Liberia, when we started, last year, my wife and I went to Liberia to see my mother and family. And after she left Liberia from 11 years old, she has not been back. But she was very excited to be home. We were having dinner at the hotel where we stayed. And she says, well, we need to do something here. And I said to her, yes, we can invest here, but if we invest, we're not going to do anything retail. Because if we do retail, we're retailing our money. And we started to discuss, because we support 12 kids in school in Liberia. Every year we pay their school fees. And just in that time while we're discussing, I came across the press statement from the manager saying that President Boyka has given executive order for tax off or duty free for rice import in Accessoria. We have the thing that we're going to invest into Liberia. When we started, after we got all of the registration things through, we left Liberia and we were able to get our business registration. But we came to find out that the rice thing, you have to go to Ministry of Commerce. And we were told that you will not get it because it is political and it will take you 2 to 3 years. And I said to them, as long as God put it on our hearts to do it and He made the finances available, we will do it. We applied in June. That's why I say President Boyka is the Moses of Liberia. We applied in June, and in October I got on the plane for 8 days and went to Liberia, and the deal was closed. And we got our license to import rice to Liberia. And you asked me what are some of the challenges that I see.
Chief, you get into my question now? Yeah.
Oh, okay.
I'll give you 1 minute quickly.
Okay.
I'll give you 1 minute.
Yes. What are some of the challenges that
1 minute, I'll give you 1 minute.
What are some of the challenges that I see and with the process? The process is good, and Ministry of Commerce has experience in professional staff. And I just want to applaud Minister that God said for her brilliant and leadership that she has over the Ministry of Commerce. Excellent staff, excellent minister. And I want to tell you, the main challenge that I see is the testing process. The money is too high if you want Liberians to invest. And Minister Rees and I discussed it on several occasions. And he said, no, we shouldn't be charging, the lab shouldn't be charging 300 or 300 plus to do a sample test just for one grain or rice. So we carried 20 different samples and we're charged that amount of money. Okay. And if you want Liberians to invest, we have to give Liberians more incentives for investment.
All right, Chief. So they say it's always an error to get a preacher man a microphone for 1 minute, but I will take the beating for that. So I will put a spin on his response that an opportunity to invest. If you're in a laboratory business for testing rice and you're in the diaspora, there's your investment bucket. Think about it. I will take one aspect and then I'll close the comments because I'm trying to be as quick as I can be. Investment is often narrowly defined as money in infrastructure or business. Yet philanthropic and social investments like in education, health, and civic engagement can sometimes yield the most sustainable impact. Now, how can Liberians, as Liberians, start to broaden our understanding and emphasis on investment just from commercial activities to also social impact? And I'm going to make an offer with our honorables in the room and to President Boyka giving his stellar leadership. I agree with you. Everybody said it will be impossible for ordinary Liberians to get rice importation license. So we must congratulate President Boyka on that for putting in the process. My offer, I saw everybody clapping when they said we built the Liberian Learning Center when I was coming up. We're making an offer that we can work with the Liberian government to raise the money required to establish an autonomous agency that will be Liberia's first national library and museum systems. Again, we're not asking President Boyka for money. We said we will go out and work with the same partners who raised $2 million and hand it over to us to solicit the investments required because we know government does not have the resources to do it all, so we'll do our part. With that being said, I will turn to our panelists to give their closing comments. Wrap anything you wanted to say in that. We'll keep it to 1 minute. You saw the sound. Now my cue now. They want me to leave the stage now. So we will start with you and we'll end with a man. Just to be careful. Start him.
It's good that he's ending with the picture. But first, what I want to do is retract and thank the President, His Excellency, Joseph Boyka, for convening this conference, the first of its kind, to bring together expert minds here to discuss where we want to go. I would like to introduce the lady that is responsible for this vision we try to implement. And that lady is staying, with you, and I would like to ask Sylvia Flobo to stay, who is the CEO of the Smart. her is Zaka Gibson, who is our technology expert. And also our senior consultant who was here earlier today. Regrettably, he had to go home because he's one of those that wears so many hats. Bishop Tabla. He had to go back to Minneapolis because of previous engagements. What I would like to, in order to answer the question very quickly for us to move from here, is that
30 seconds.
we, as Liberians, we have the resources here. We have everything that it takes to take Liberia to the next level. So it is up to you and I now to roll up our sleeves and respond to the President's call.
Thank you.
Thank you.
Thank you so much. My sister Irene, I will let you give your closing comments and final remarks.
So first of all, I want to be grateful to the President, His Excellency, Joseph Mwambaka. And I also want to admonish every one of us here that building confidence in investment is not just about policies. It's about trust, transparency, and resilience. The government must create the enabling environment, but we in the diaspora must also take initiative, share our experiences, and support each other. Diaspora investment is not just business, it's a vote of confidence in Liberia's future. And I, for one, believe in that future. To my dear brothers and sisters in the diaspora, international partners, we need your support. Whenever you invest in Liberia, whenever you visit Liberia, please make ES splits and pull your stock. Please stop by Kere and Clay intersection in the Shintamjo building, first floor. Your support means a lot to us. Share our story. Spread our message to your friends, your families, and networks. Together, we can continue building the Liberia we dream of, a Liberia of hope, opportunity, and pride. Thank you.
Thank you, Aaron. And so I want you all y'all who can book Airbnb. She said Airbnb there too. And they got CO, the intellectual center right down the street. So if you want entertainment, you can just stop down to CO2. Preacher Man, is the
sorry. About the Airbnb, we don't have an Airbnb yet.
So you maybe that free promotion.
We are working on establishing an Airbnb.
Got it.
With the name of ES Luz Feb Life.
Got it. So when Airbnb ready, I'll post it. Yeah, you don't worry. We will turn to the preacher man, my boss, that the benediction. It's a shortcut, huh? Yeah, it's a benediction. So
I would like for everyone in here and those that are watching us from the diaspora and around the world to please go to your phones and go to Facebook and type in LIAM, L-I-A-M, group of companies. That's the Liberian-owned rice importer in Liberia. And I want to ask all government officials that are here to please support Liberian-owned businesses. We work very hard in the United States, and we take our money and go home, and we need our government to support us. Because if the government officials does not support us, that means that they do not support President Boyka's vision for liberalization in our nation.
thank you.
And lastly, we are not just importing any kind of rice to our country. We carry rice that is long grain, parboiled rice, 100% premium, no cholesterol, no added sugar, minimum starch content, and you can purchase the rice from here for your family members. Let us eat healthy, let us live long, and Ambassador Don, I want to say thank you. My Sunday school teacher, my children's church teacher. God bless you.
Amen. With that being said, Can I get an amen? There we go. We gotta hold the flow, right? So we'll keep holding the flow. Now, I'm gonna do something very special. I don't think they'll call me out of moderate partner again when I leave. So I will tell my one chance I get. I'm gonna do something very special. Is the CEO of Too Easy in the room? The CEO of Too Easy, is he in the room? Come on, quick. Man, double over. You doing the thing that other business. Come on, please. Clap. I'll tell you why you're clapping. Just clap. I'll tell you later why you're clapping. I'm going to call him up because he is one of, if not, the youngest entrepreneur in this room that has done an exceptional job in the area. And because there's special moments, we need special people to match it, right? And this is a special moment. So I will give him, he's not a preacher man, so he will stick to it 1 minute. To give a special testimonial as the youngest, I would say, I can look at his face and I can tell you, if he's not one of, he is the youngest entrepreneur in this room. So I thought a minute is not too much to ask for. Sir, please.
I think 1 minute, sir.
Hello.
I don't think 1 minute is fair. My name is Jack, and I own this very beautiful clothing brand. It's here on it. It's called Too Easy, endorsed by every brand in Liberia. So we started this thing in 2023. Next October actually will make us 2 years. So we have been ever since for a little time. But what we have done is incredible. Part of that is seeing me here in the US. Because of Too Easy, I'm officially here to attend this conference and tell you about the success story of this clothing brand and how every young Liberian person can now start to dare and to believe that he can do something incredible. So this brand started from absolutely zero. We had no streetwear industry in Liberia before. I can tell you, in the last 2 years, we have had close to 50 different clothing brands in Liberia itself. And this has opened so much. Today I can tell you, because of this brand, I have almost 20 employees. And that's just part of it. And because of this brand, we have been able to reach out to so many other communities to help and improve education, because we speak to a lot of people, we help people go to school, and so much. This is beyond just clothing. What we're trying to do with this is just to empower the young people in our community and make sure they believe that whatever they believe in and whatever they think they can do, they can actually make it happen. I started this thing from zero. I'm here in the US, and on October 5, we'll be doing our first ever United States pop-up in Philly. Hopefully next year, we'll do a country tour where we'll have so much for all the different states. But first thing first, we start with Philly. So I hope I let you all of the time. Thank you very much. I have some of the t-shirts here. If you want it, you can reach out to me. Thank you very much.
Yeah, see, I didn't call him off. I called him off. So all of y'all who in the diaspora and say no opportunity in Liberia, you want your own opportunities are in Liberia, they will find it. With that being said, I would like to thank my distinguished panelists for your expertise, your knowledge, your experiences. At the reception tells you people really benefited from your experiences. So please, I will say this to you. Thank you to our panelists for such rich insights, and to all of you for engaging in this vital conversation. We've heard today that investment in Liberia is not just about financial capital. It's about building trust, strengthening health and educational systems, creating jobs, and shaping a shared future. The Liberian diaspora is one of our nation's greatest untapped resources. By organizing intentionally, holding one another accountable, and broadening our definition of investment, we can transform reconciliation and healing into real growth and move forward in this conference. Let's hear with a reminder that building requires not just vision, but and today. Thank you.
Of West Africa's last remaining virgin rainforest against miles of coastline. As Africa's oldest nation, an agro-industrial everybody in Greenfield, in historic and coastal Buchanan County. Special agro-industrial processing zone, the SAPZ, and phase 1 development of the Buchanan. The Liberia SEZs will drive investments and a broad-based economy, create jobs, and transform all segments of the Liberian society. The SAPZ is an ecosystem of 6 industrial processing zones: fruits, vegetables, and tubers, cereals, pulses, and oilseeds, livestock and fish, plantation crops, and dairy, honey, and fostering innovation and world-class processing. Other zones within the SAPZ are center of excellence, specialized infrastructure and amenities, utility zone, agribusiness, and dairy farms. 3 agricultural transformation centers, or ATCs, in Nemba, Bong, and Grand Cape Mount counties form the SAPZ. Farm produce will be collected and stored at the ATCs, then transported to the production into processed goods, then distributed across Liberia and exported onto international markets. Farmers will come together at 6 aggregation centers to sell their products. The SAPZ offers exciting opportunities and possibilities for developers, investors, and entrepreneurs. Ample green fields and wide open spaces, beautiful beaches and riverfronts make Buchanan the prime destination for innovation and expansion, business and leisure. High-valued, organically grown crops in Liberia's rich soil, backed by high rainfall in West Africa's last remaining virgin rainforest, means factories for manufacturing the highest quality products. Boasting the world's largest maritime ship registry, the SAPZ is only 3 miles from Liberia's second deepest seaport, the Buchanan Port, 33 miles from Roberts International Airport, and 70 miles from Liberia's capital city, Monrovia, and Freeport. The SAPZ at the heart of Liberia's business and industry. Easy access to major giants as ArcelorMittal Liberia calls Buchanan home, plus access to ECOWAS 350 million and a trade regime backed by the region's tax breaks and duty-free across all 15 countries. Liberia's young, vibrant population, hard-working farmers are reasons why Liberia is a prime agro-processing destination. A developer will engineer Liberia's emerging agro-industrialization. Operators stand to benefit from an unsaturated marketplace. The SAPZ is a game changer for farmers, market women, the youth, and Liberian business owners and entrepreneurs. The SAPZ project is a smart, sustainable industrial park designed to take agriculture to unprecedented levels. Smart ICT solutions guide mixed use, open spaces, urban planning, utilities, and more. Renewable energy powered by wind, biomass, non-fossil fuels, solar, and biogas. Planned spaces include residential, healthcare, and recreational spaces. Environmental infrastructure for rainwater harvesting, sewage treatment, composting, and recycling. Industrial infrastructure features research and development, innovation, training, laboratories, and testing. Physical infrastructure as roads and pavement, pedestrian-friendly walkways, water storage facilities, public open spaces, and treatment plants. The government of Liberia is committed to establishing a strong SEC regime for economic development to expand and diversify the country's export market. A dual currency, Liberia is positioned to lead in manufacturing and agro-processing. The Liberia SAPZ adding value to Liberian produce.
Thank you very much. The president should be in the room to ask everyone to please find their seats. And I'd like to thank Leo and the panelists and all our panelists this morning for the interesting plenary session 1. Let's give them a hand.
that are in front of us. Session 2 is about to start, and would like to invite the host for the second plenary would be Al Jerome Chetty, Minister, Counselor for Press and Public Affairs of the Liberian Embassy here in Washington, D.C. Al Jerome.
And when we were growing up, everybody wanted to sound like Charles Russell. Let us give him his flowers while he's still around. And to a very great big brother, Martin Lambert Brown is not here. Martin Brown, the golden voice also. Distinguished ladies and gentlemen, very quickly for a very short remark before we go into our presentation on the health sector, I want to call on Mr. Ansu Dualo for a 2-minute remark, and I mean 2 minutes. It's a new sheriff in town. Mr. Dualo, you know on this day in 1846, there was a referendum where the colonists decided to break away from the ACS. Just something to ponder about.
Thank you so much. I didn't expect to have 2 minutes, but I'll be very quick, and I'll get directly to the point. First of all, I want to say this. Those of us in the diaspora, we are punching far below our weight. The Liberian Diaspora Equity Fund is something we set up to go home properly. It has 5 basic tasks. To get 2 minutes to explain money. Number 2, area. Number 4, we have to build Liberian industries. And number 5, we have to get Liberian expertise back to the country. This has been done for the last 15 years. Me, my wife here, we invested millions in the country. But what I've learned over the years, Liberia will not grow if we continue to do these half steps that we're doing. Something massive has to change. And the only way we can change it, we have 20 diaspora. We're not doing it. And I want to say this. Look, we continue to joke around. One person goes home, that person fails. That person runs back to America. It has to be done in a corporate fashion. And the Liberian Diaspora Corporation, I want to tell you guys should have did me wrong tonight, but we will continue to put, the president is fully aware of this. Liberia, each take your proper. We're not taking our places or in our Liberia properly. And the only way we can do this is to collaborate our fund through a cooperative. We formed a corporation that 5 months ago, over 100. The money we are registered in the state of Massachusetts and with the federal government. Liberians, it is okay to take a shot home. Diaspora Bank, for a hospital in the university. And we start building giant, great things to transform Liberia. The conference, we'll have it every year, and nothing will come from inside. They're going to give everybody the money.
That was a very, now, Mr. General, Republic.
Present anything as a president coming in, and I'm here to announce it in the absence of the chief of protocol and the deputy chief of protocol. So that's why I just want to get you in queue that the president will be coming shortly. Thank you so much.
So we can stay here in front of us.
Yeah, but the panel can just hear while the president is on his way. Okay, all right. Well, I give you the opportunity.
Honorable Minister, thank you so much, and I understand that. We will share the information, but they gave me 2 minutes, and as a former military man, I like to stay within the confines of my time. Look, has it been 50 years, 60 years? Since 1980, we've been here. America has given us everything. We've achieved nothing in the country. You know, I'm talking, I want to help business, we're going, we say, we have achieved nothing. I'm not talking about going home and building your own house. I don't care about that. If you don't live outside, that's your business. But this is what I want to tell you. We send home approximately $500 million home every single year through remittances. Nothing inside. Diaspora Equity Fund is something we intend to do. If you're listening, we should have done a presentation, but we were not added to this thing. And it's hurting me badly. Take this number, 774. Good. 774 526 7611 774 526 7611. My wife, she's been tagging along for the last 20 years, but she's been ladies and gentlemen, the President of the Republic of Liberia and the First Lady, Madam and entourage.
Mr. President, Madam First Lady, government officials, all protocols. New Day. About 2,000 years ago, Virgilius model, and I paraphrase, he said the greatest wealth of a nation is its health. A great influencer from India, Mahatma Gandhi, also said, the wealth of a nation cannot be counted in its gold, iron, diamond deposits. It should be calculated in the wealth of its people. How healthy is Liberia? While we ponder on that, the Minister of Health, Dr. Louis Mable Putu, should be giving us a very clear picture in the presentation. But an able proxy, who is the technical assistant to the minister, Mistress Memezi Peabody Kiati, will mount this podium and tell us how healthy our country is. Ladies and gentlemen, welcome to technical assistant.
Fellow Liberians, my name is Memezi Peabody Kiati. I am a registered nurse. I work with the minister. I'm as proxy on behalf of Dr. Puto, who unfortunately isn't able to be here today. It is my pleasure to be here. It is my pleasure to serve my country in my capacity. I do have a video to show. Can you run that video, please?
From January 2024 to August 2025, under the dynamic leadership of Dr. Louis Poto, Liberia's Minister of Health advanced a bold vision to build a resilient health system that delivers quality care for all. New infrastructure took shape. The Balatua Regional Diagnostic Center in Bong County, a neuropsychiatric hospital in Bentall, and the renovation of 12 health facilities across 6 counties. These projects expand access where it is needed the most. At the heart of progress are the workers. Salaries for more than 5,000 health professionals were upgraded. 666 volunteers joined the former system, with 813 more now in processing. Specialized training for scrub nurses, radiographers, and anesthetists filled critical gaps. And for the first time, a national health workforce census spanned 912 facilities, giving leaders the data to plan better for tomorrow. Information systems grew stronger. A nationwide electronic immunization registry now tracks vaccines in real time. Data verification and COVID-19 integration close critical gaps, ensuring decisions are driven by evidence. Financing also moved forward. The national health budget rose to $80.1 million, translating to 10.4% of Liberia's total budget. Liberia met its requirement for the first time in a decade, restoring global confidence. And revolving drug funds in 75 facilities are laying the foundation for sustainable medicine supply. Supply chains improved, where stockouts once reached 90%, availability of essential medicine now stands at 95%, ensuring that life-saving drugs reach patients on time. In service delivery, lives are being saved, maternal deaths declined, facility deliveries increased, and new vaccines against malaria, HPV, polio, measles, and mpox expanded protection nationwide. Investments in diagnostic brought gene expert machines, digital x-rays, ultrasound systems, and a CT scan at JFK Medical Hospital, strengthening case management across Liberia. Malaria cases dropped, HIV treatment neared global targets, and mental health services grew with new specialists training and the country's first neuropsychiatric hospital currently under construction. On the global stage, Liberia's leadership rose, earning positions at WHO and representing Africa in World Health Forum. Together, these achievements mark a turning point, moving from fragility to resilience. The achievements of the Ministry of Health from January 2024 to August 2025 illustrate a sector in transition. Progress in infrastructure, workforce, financing, accountability, and disease control reflects a health system that is steadily recovering and moving toward resilience. Challenges, however, remain, particularly in maternal and child sustainability of financing. But the foundations for long-term improvement have been firmly laid through both domestic reforms and international recognition. Liberia's health sector is now better positioned to meet the needs of its people and to respond to future health emergencies. May God bless the Republic of Liberia.
Presentation, please. Diaspora Conference participation. I am not Dr. Butu. I'm going to do my best to speak for her. Next slide, please. Okay, this is an outline, an overview. I'm going to talk about some of the health challenges, our key focus areas, some achievements, our future plans for Liberia in the health system. So we're about 5.4 million people. There's 15 counties. We have about 98 health districts. In Liberia, we have three levels of care: primary, secondary, and tertiary. There are 121 functional health facilities right now, 84.9% health clinic, and 43 hospitals, which is about 4.7%. And then 29%, what's challenging here is 29% without access to a health facility within 1 hour walk. So that is a challenge that Dr. Puto is trying to correct. So the performance, the health system performance. And if you are aware, Dr. Puto is OBGYN. So women's care, women's health, and neonatal health care is a concern, and I know that is also the First Lady's concern as well. Can you go back to that slide, please? Okay, so one of our challenges is we have a high maternal mortality rate. So for every 100,000 live births in Liberia, currently we have about 742 deaths. So, and as far as the newborn death rate, we have about 37 per 1,000 live births. So that's also a concern. We have a low health worker density. The World Health Organization recommends 23 health workers per 10,000. We have 13.9, so you can see the challenges we face. Still on that slide. I'll tell you when to go, I'm sorry. So also some of our challenges are also low motivation of health staff. We're looking at remuneration in career growth. We have large numbers of volunteers. We did make some accomplishment here. We have about 501 nurses now on the CSA payroll. So that's a really good change. The infrastructure, including our equipment. So what the minister is trying to also do is, you can move on to the next slide as I'm speaking. Thank you. What she's also trying to do is to make sure that we have the right equipment available to our healthcare workers, so that when people come in for primary care, we can target and hopefully diagnose those diseases early, so that we're looking at when people are extremely sick and trying to leave the country. That's one of our challenges. People always leave the country for care. So we're hoping that getting in the right equipment, we can diagnose these diseases so that we can treat right away. So we have improved, we want to improve maternal and newborn child health services to decrease maternal mortality, decrease the newborn death, and decrease stunting, which I think the Ministry of Agriculture presentation also talked about, because the kids are malnourished, so it stunts their growth rate. Also improving referral and linkages between primary and levels of care. Increase opportunity for career growth by all staff, irrespective of whether you're a nurse or a doctor. And digitize health records. There are some questions. We are having conversations about electronic health records. That is in the work right now, and we're also talking with key stakeholders. So increasing probability, accountability, and transparency. I have seen that from working with the minister. I'm very proud of what she's doing. Introducing the National Health Insurance for Liberians. Right now, that is in the work. Very excited about that, because I think that would benefit everyone, but regardless of your income level as well. So we want to increase collaboration and joint planning with all stakeholders, our national partners as well. Next slide, please. So leadership and governance. I believe Minister Kafwan talked about the budget, so you can see that right there. I'm a nurse. I don't think I should be discussing the budget, but there's some figures right there, and this will be also available on the Ministry of Health website. You can also follow the Ministry of Health on Facebook as well. We revise our key policies. We focus on strengthening our priority areas, and I just talked about the health insurance scheme. And let's see, we can move on to the next slide. I'm going to jump over some slides because Dr. Dunn gave me a time limit, so I'm trying to stay within that time limit. Okay, what we've also done is making sure that the drug is stuck to the last mile. So we piloted the community health pharmacy program. We piloted that at CD Dunbar in Bond County. It was very effective, and now we're going to take that to other counties as well. So that was a great pilot. So she's decreased our drug stock out rate from 90%. We didn't have enough medication, to 10%. I think that's admirable. So increased accountability of medication. National task force have been established. No reports of missing medicines and health supplies. So we're doing audits as well. Right now, we're tracking the immunization registry. We're tracking children under 2. So we have real-time data on that as well. So you can go to the next slide. Thank you. Okay, so I talked about this already. Increased remuneration of 5,675 health workers. There is it right there. We move over 500 staff from volunteers onto the payroll. So as far as workforce development, we're training some stroke nurses, radiographer, and nurse anesthetist. That's right at TNRPMA. We have new residency training programs in radiology and anesthesiology, enhanced special training for the Ministry of Health staff in other countries. We have some nurses, and we have some nurses actually right now in Kenya. I actually went on that visit with the ministry. We have nurses at Amref University, in Nairobi, Kenya, and also Gertrude Pediatric Hospital, who went and visited, and nurses being trained. We also have nurses to work to be dialysis staff. So real-time, hands-on, actual account of training being done. So the regulatory body, the LIBERIA Medical Dental Council, Nursing and Midwifery Board, Pharmacy, tracking and prosecuting fixed service providers, as well as unregistered facilities. So we actually have the ministers going into those facilities and her team as well. Because we do have some challenges. Everything is not going to be changed right away. We've had a fragile healthcare system since the Civil War. So it's taking some time, and we'll talk about partnering with the diaspora as well. So registered non-debarred facilities providing services. The malaria vaccine was in 2024. 6 counties right there was treated. Vaccination coverage from May 2024 through August 2025, 45%. That's great. We have a reduction in malaria, and HIV rates decreasing. Next slide, please. So we are increasing our health infrastructure, primary and secondary health facilities. We have 80% completion of 150-bed maternal and pediatric hospital, the New Redemption. I also work as a labor and delivery nurse when I do bedside nursing. Increased community engagement towards inclusive community drug revolving fund, and procurement of MRI. We showed that in the video, the MRI machine at JFK. As the minister with some of her staff and partner. Next slide, please. So rebranding the healthcare sector under the leadership of Dr. Butto. This is my visit to MREF. This is some of the nurses. So the guy in purple sweater is a staff. That's me with a bag hanging on my arm. World Bank Rep, Dr. Tia Saki Mo, Dr. Balam, the Deputy Minister of Administration, Martha Morris is right there, and some of the nurses that I've been trained. So plans for our future, we're opening a midwifery school in Bombing to serve the Western Cluster. So that is Bombing, Grand Cape Mount, and Bapulu counties. We're also opening a dental training institute. We're increasing the capacity of biomedical technicians to handle new equipment, because that's been one of our challenges. We get equipment and we don't have biomedical engineers to work on those. And so when they spoil or there's an issue, we can't use the equipment anymore. So that's a good thing. Construction of additional regional diagnostic center in Bombing to serve the Western Cluster. Establishing a mobile surgical team to deliver services in hard-to-reach communities, and construction of a staffing house for the healthcare workers. We actually toured some of those facilities, and they really needed to be updated, bring it up to standard for people to live in. Okay, so collaboration with the diaspora. We want to increase the participation of the diaspora in the Liberian health system. So right here, one of the things we talk about is for the doctors and surgeons, physicians, surgeons, nurses. What the minister is hoping to partner with you on is on your sabbatical. When you're moving, when you go to Liberia on those extended times, we have some attrition in the rural areas. We're hoping that you can partner with the Ministry of Health when you're in Liberia and go into the rural areas and work, do those surgeries, see those patients. And it's not voluntary, you will be compensated. So we want to harness untapped potential to mobilize and increase health investment, capacity building, I just talked about that. Formalize a diaspora health partnership framework under the Ministry of Health. We're going to call it the Diaspora Health Desk. And potential outcome, we're going to increase special training and exchange program. I know that there is some group that currently go to Liberia. We're hoping that this can be through the Ministry of Health so that it's cohesive, that we all work together. Continuous professional development program. Temporary skilled professionals will be hired. Improve the digital health records, telemedicine, and innovative technologies. I talked that we're looking at our own EHR system, electronic health record system, and improving public-private partnership to increase diaspora-led business in the health sector. That's me. Minister Cheo, the Deputy Minister of Policy and Planning, and Minister Buttel. So I just talked about the health desk at the Ministry of Health, which will serve as like a help desk. So everything you want should come through the diaspora health desk, so that we're not going around trying to figure out, okay, how do we get in touch with the minister? Because the minister is over 5.4 plus million people. So can you go right back to that slide for just 1 second? Okay, sorry. All right. So exploring partnership models and agreement options for win-win collaboration. Okay, so we're thinking that this is going to be a flagship, because I know that this has been a challenge. Next slide, please. And since Dr. Koto is not here, there is a panel coming up. So I'm going to skip the question and discussion for the panel. Okay? And thank you so much.
Thank you very much, Madam Kelly. So, a great essayist and critic, Great Britain once said, your body is the only place you have to live, so take care of it. Health is wealth, health is power. There are a lot of local vendors out there who supported this event. We encourage you to visit them, purchase what you can to help support them. Dualu has a very important message, and we'll keep Dualu in the queue. Now, ladies and gentlemen, we want to welcome 2 minutes remark because of time. The International Organization for Migration, Regional Director for West and Central Africa, Madame Sylvia Ekra.
Your Excellency, Mr. President of the Republic of Liberia, and Madam First Lady, Honorable Ministers, Your Excellency, the Ambassador of Liberia to the US, distinguished chairs of the Liberia Diaspora Annual Conference, the head of the Office of Diaspora Affairs in Liberia, our esteemed officials from the government of Liberia, my colleagues from the UN and UNDP, and beautiful members of the Liberian diaspora here present. It is a profound honor for me to speak before you today, not only as the IOM Regional Director for West and Central Africa, but also as a daughter of the diaspora myself. I left my country when I was 2. I grew up across several countries, and I hold 2 nationalities. So within me, the experience of always having been a little bit here and a little bit there. So it is really with particular respect that I salute and pay tribute to all members of the vibrant Liberian diaspora who have answered the call and are present in this room today. And I absolutely love the energy in this room today. In addition to my personal experience, the very first assignment that I was entrusted with 23 years ago, when I joined IOM as a young professional, was precisely on mobilizing the diaspora for the development of the African continent. So this is my first area of expertise. And since then, nothing has replaced the deep conviction that I carry that diasporas are forces for transformation. And that is why I commend the government of Liberia for this remarkable initiative, for the vision that this forum embodies, and for placing it under the highest authority of this nation. It is a strong and long-awaited signal that resonates fully with the ambition of building a prosperous and inclusive Liberia. Thank you so much, Mr. President. That the new National Development Plan, the Arrest Agenda for Inclusive Development, places the Liberian diaspora at the center of its implementation as both stakeholders and financing partners, provides a powerful foundation that lends weight and continuity to the commitments that will emerge from this forum. And the chosen theme, healing, reconciliation, and rebuilding a new chapter for Liberia is equally profound. And here I want to say something. Many of you may not know that IOM has been facilitating the transportation of all the Liberian refugees that have resettled to the US, to Canada, and to Europe after the crisis. All. And I met at least one yesterday, and I know that there are many of them in this room, and I'm particularly moved to think about the journey that the country has traveled since then. Really, it is remarkable. Excellencies, ladies and gentlemen, I would like to share 4 key messages. I was given 2 minutes, but I have traveled from Dakar to share those convictions with you. And these are really deep convictions that were shaped both by my personal journey, but also by more than 20 years of professional experience on these issues. So first, now, remittances have surpassed official development assistance. And at a time when traditional aid is declining, diaspora contributions appears as one of the most powerful and consistent levers for national progress. In 2024, diaspora across West and Central Africa have transferred $35 billion US. And the Liberian diaspora alone, the same year in 2024, sent $800 million US in remittances. And that represents almost 17% of the national GDP of Liberia. You can clap for yourself. So this conference is therefore a crucial opportunity to reflect collectively on how to transform this potential into a sustainable engine for inclusive growth. Second conviction, we are not starting from scratch. This effort builds on a foundation that is diaspora-driven, national, regional, and continental, and I'm going to explain why. First, from the diaspora perspective, we are building on a Liberian community in the United States, in Canada, in Australia, in Europe, in Africa, that is large, that is organized, and that is deeply rooted with long-standing achievements both at home and abroad. So we are standing on the shoulders of these achievements. From the national perspective, I have already mentioned the central place of the diaspora in the arrest agenda. But most recently, on August 6th of this year, the government of Liberia, with the support of IOM, launched the Diaspora Engagement Task Force at the Executive Mansion in Monrovia. And this Diaspora Engagement Task Force that is led by the Office of Diaspora Affairs, and I want to salute and give kudos to the indefatigable head of the Diaspora Affairs Office. They are coordinated through the Ministry of State for Presidential Affairs and the Ministry of Foreign Affairs, the task force to institutionalize diaspora engagement as a core pillar of national development. Now, at the regional level, Liberia is part of a rising wave of recognition that the diaspora is central to our collective prosperity. Last July, Mali convened its first forum. I was there in Bamako. 2 weeks ago, the Prime Minister of Senegal launched the diaspora bonds for Senegal in Milan, in Turin. In Milan, in Italy. They will organize their diaspora forum in December. And Mauritania is going to organize their diaspora forum in November. So the entire region is seizing this opportunity, and Liberia is showing the way. And at the continental level, the African Union's Agenda 2063 places the diaspora at the heart of Africa's aspiration for development and transformation. And they have formally recognized the diaspora as the 6th region of Africa at the African Union. So consider yourselves not only as proud Liberian diaspora, but also as part of a rising African diaspora that is taking its rightful place. So everywhere good practices are emerging. Nigeria, for example, has successfully harnessed the momentum of its diaspora through specific bonds, and the Minister for Finance was talking about bonds this morning, mobilizing millions of dollars to strengthen their foreign exchange reserves. These are the kind of things that we can do with your remittances. So Liberia, by gathering this forum today, is not acting in isolation. It is feeding into a regional momentum, and it is helping shape
an emerging vision that diasporas are not peripheral actors, but they are central architects of Africa's prosperity. Third conviction that I want to share, the impact is real, but it can be multiplied. We know the transformative effect of diaspora investment and skills transfers. They feed, they provide access to health and education, they create businesses, they build homes, and they stabilize our youth. We've been talking about creating jobs. This is how we don't see our young people embarking on perilous journey on the Mediterranean Sea to try and reach Europe. And across the continent, we are seeing clinics, agricultural cooperatives, and schools come to life thanks to diaspora commitment. But we need to embed these dynamics for the long term and at the necessary scale. And this is what your ministers have been saying. We need to move away, although we need it and we respect it, and it's important to build human capital. We need to move away from the small transfers that are sent to households, to investments, productive investments at scale. And for that, we need the financial institutions at the table. We need the African Development Bank, we need the World Bank, we need the regional banks, the public and the private investors. EcoBank was here. They all have a role to play because the potential is immense. But to fully unlock this, we need strong alliances, collective frameworks and partnerships that match our ambitions. And we are counting on Liberia to be driving some of those alliances. Fourth, and my last point, is that our ambition must be a long-term relationship of trust with the diaspora. Too often, the diaspora is treated as an abstraction. Yet, behind every remittance is a person, a story, and very often a sacrifice. And for this reason, whatever the circumstances, diasporas will continue to contribute. They're not waiting for us. Especially when families and communities are in hardship, the diaspora has always been there. But this contribution should not be taken for granted, nor left without recognition. And this forum is a first step in that direction. And really it's heartwarming to see. So we have to continue to design policies where support flows in both directions. We must listen, and we've been listening really intently for the past 2 days. We must protect. We were asking for consulates yesterday. We must equip and honor the diaspora. We must offer services, financial products and rights, not as an exchange, but as recognition. Recognition that members of the Liberian diaspora are partners, co-authors of this new chapter, and not just remitters. The next step is to turn individual commitments into collective vehicles that build jobs, skills, and growth. And because the diaspora is diverse, we must design instruments that reflect the diversity of this diaspora. It has to make sense across social classes. We are not just talking to the elite. It has to make sense for women, it has to make sense for the youth, it has to make sense for second generation and third generation. I have seen some kids in the room. Excellencies, ladies and gentlemen, let me conclude with this thought. A new chapter is not a new cover on an old book. It is new pages written together. And I think that's what we are doing here with this forum. This is the moment for change. Here momentum can be born. And it is together that we can lay the foundation. And at IOM, we have been supporting more than 100 member states in doing the same thing that you are doing here. We have the tools to support your ambition and your journey. For example, our diaspora mapping guide, with a proven methodology to map diaspora communities where they live, is something that we are putting at your disposal. Most recently, we completed a detailed mapping of the Ivorian nationals in 2 French cities, and a similar exercise is being planned for the Liberian diaspora in the United States and in Canada. So, Excellencies, ladies and gentlemen, healing begins when the future feels possible. Together, we can create a framework where the diaspora is not on the margins, but at the very center of Liberia's future. The journey ahead will be demanding. It's not going to be easy. The path may be hard, but let me leave you with one quote from Howard Schultz, who is the founder of Starbucks. He said, "When you are surrounded by people who share a passionate commitment around a common purpose, anything is possible." So, united in resolve, we, as your partner, can shape a new chapter for this beloved country of yours. And it will be our honor to stand beside you as you do so. Thank you very
much. What a powerful 2 minutes delivery. Congratulations for making such a wise use of that time. 2 minutes, so short. Regional Director, Sylvia Ekra. The significance of the diaspora have cascaded into several headings since yesterday. Firstly, the diaspora being considered as a major partner in the development of our country. The rousing presentation by Erasmus Williams, who's commonly known as the president of the diaspora. Then the demographic statistics by Dr. Al-Hassan Conte. And then the pledges of support from the President Pro Tem, the Honorable Minister of Finance, Honorable Minister of Agriculture, and the display by the LRA boss. All these things have shown to us in the diaspora that although we are significant, but we are part of a collaborative team, that Liberia cannot succeed without us, and we cannot succeed without Liberia. We are nothing without Liberia shining. The onus is upon us to stop all the talk. We've talked a long time. I'm about to introduce somebody very important who supported our effort. And that person should have been introduced by the veteran Charles Russell, who decided to decline and allow me to shine, just as Madam Magdala Cooper did yesterday. So thank you very much, Mr. Russell. And now welcoming to this podium, the country director of the United Nations Development Program, Republic of Liberia, Mr. Aliu Dia. Thank you.
Thank you so much. Bonsoir. Your Excellency, Mr. President, Madam First Lady, Honorable Pro Tem, members of the legislative branch, honorable government officials, Mr. President, it's really, for me, very difficult to say something meaningful after your brilliant speech of yesterday. It was inspiring, very inspiring for all of us who were in the room. And what to say after my sister from OIM has spoken so eloquently. So I will try just to say a few words, Mr. President. For us at the UN in general, in Liberia, speaking also on behalf of our resident coordinator, Madam Christine Omutuni, who couldn't make it, this is a privilege for us to be here. Mr. President, I, as UNDP, did not want to fund an event like this. What we funded is your call to action. And that, for us, is very important. So Sylvia has talked about why you guys matter as the diaspora, but I will challenge you. And those who listen to me in Monrovia, in Liberia, they know I always want to challenge in my speeches. So I'm here to challenge you, the diaspora, the Liberian diaspora, challenge all of us. Sylvia has talked about it. Every year, Liberians abroad send close to $1 billion to Liberia. This keeps families afloat, it pays tuitions and support households. And that's what you have been doing. But let's be honest here. Remittances alone cannot transform our economy in Liberia. Because we're not using them to build power grids. We're not using them to build industrial parks in Liberia, and we need them. We are not using our remittances to build hospitals. The Minister of Health has just shared something here on health. So, if the diaspora limits itself to consumption support, then Liberia will remain stuck in survival mode. Right? We agree to that. Okay, so let's use our remittances not only for survival mode, which is good, by the way, but we want to transform our country. Right? So, if diaspora channels even a fraction of those resources into productive investment, Liberia will leap forward. Because as Sylvia has said, other countries are already doing it. The Nigerian diaspora is mobilizing almost 20 billion annually. 20 billion annually. And much of it is fueling now banks. The money is going into banks. The money in Nigeria is going into fintechs. The money in Nigeria is going to real estate and so on. Ethiopia has been walking around to see diaspora here in Washington. The Ethiopian diaspora has been heavily investing into Ethiopian Airlines. The Ethiopian diaspora has almost funded or financed the Ethiopian dam that has been inaugurated weeks ago. You take the Ghana is almost the same into agribusiness and SMEs. And now Ghana, we know, is one of Africa's most attractive investment destinations. And that, the Ghanaian diaspora has played a critical role in that. So the question is, why not Liberia? We can do it. So I want us to commit for that, and we will do it. Of course, the Liberian diaspora has already done some amazing work. Those things that I've said, it's not like nothing has been done. You guys have done amazing work into using your remittances also to support development. If you take medical care, the diaspora professionals help establish, as far as I was told, I'm quite new in Liberia, the diaspora has helped establish the Jackson F. Doe Memorial Hospital. In education, you have been building schools, entrepreneurship, SMEs, and so on. Because these are important, but as far as I know, they remain fragmented and at small scale. We need to be bold. The Minister of Finance always challenged us in Monrovia by telling us as development partners, you have to dream big. You need to be bold, because the government is bold. The president has ambition for the country. So if you're not being bold, if you're not being, dreaming big, then we're gonna won't be achieving big things. So that's why I said they are small in scale. Imagine what could happen if these efforts were pulled into a diaspora development fund of 200 to 300 million to do something meaningful for the country. Imagine if capital was directed not only to housing, but also to renewable energy, to agro-processing, to digital startups, and to industrial zones. We're now talking about development of Liberia. So I believe, Mr. President, that the diaspora engagement must evolve. It must evolve from charity to strategy. It must evolve from nostalgia to innovation. And it must evolve from sympathy to investment. So that means pulling capital into structured investment vehicles to finance infrastructure, climate smart agriculture, the Minister of Agriculture has talked about it, and to finance technology. Nothing will happen if we are not into the technology in Liberia. We can use technology to leapfrog, but we need investment. And that's why UNDP a few months ago has agreed to sponsor the very first, under the vision of His Excellency Mr. President, the Liberia Tech Summit. The very first one. And that summit was a groundbreaking event. So the Liberia digital technological ecosystem is vibrant, but we need to bring those people together and then start moving forward into technology. So that's what I think many people has talked about. Investing in growth sectors. I talked about agribusiness value chain. The minister has talked about it very clearly this morning. The digital economy. UNDP with the University of Liberia will be starting in the coming months the very master program on artificial intelligence, cybersecurity, and digital transformation in Liberia, because what we want is for the Liberians harness and to be trained and to be experts on artificial intelligence without flying out to go to other schools. We're starting that in the coming months. So I'm appealing to you, whoever you know in the diaspora who is engaged into artificial intelligence, cybersecurity, digital transformation, please send that person to us so that we can bring him to Liberia to help. So, great. So we're gonna actually. So UNDP is working in a lot of other areas. I won't come to them because I think because of time. I'm just gonna be challenging you by closing these remarks. Just asking you one question. And please, you have to reflect on that. So do you want to be proud Liberians growth? Yes. Okay, great. Or will you want to become bold Liberians investing at home? Either one of them. Of course, we're all proud to be out there. I'm a Liberian, yes, good. But I am a bold Liberian investing back home. That's what I prefer, right? Yeah. So, will you be content to build homes in Monrovia? I know most of you are building nice houses in Monrovia, or will you be building factories, energy systems for our communities in Lofa, in Nimba, in Granjide, in Bomi, Grand Cape Mount, Maryland, or are we going to build houses, or are we going to build universities? University that will carry Liberia forward in the future. Will you be sending money for today's needs only? Or will you plant investments that yield jobs, innovation, and prosperity for tomorrow? Will you be remembered as a diaspora that loved Liberia from a distance? Or as a generation that rebuilt Liberia with your hands, with your minds, and with your capital? So I believe that the opportunity is now. Liberia, as we saw this morning, has vast natural capital. We have the African continental free trade. Liberia has young population, government reform and international. But above all, Liberia has a great leader with a vision. So the window for all of you guys, the window for all of us is now, before it becomes too late. So let's be clear. A Liberia story will not be changed by speeches or photos from this conference. We're all taking photos next to the banner here. But that will not change what we want to do. So it will be changed by the industries that you will finance, the startups you will be mentoring, the hospitals you're going to be building, and the renewable energy plants we will be investing in. That's going to be changing Liberia. So let us leave Washington. Let us not leave Washington with nostalgia alone. Let us leave Washington with commitment, with capital mobilized, and partnership signed. Let's be clear, history will never judge you by the money you have sent home. You send 100,000 today, you send $100 today, tomorrow the person will collect it, will eat it, and you will forget it. They will remember you. They will remember you. I mean, I live in the diaspora. I know what I'm talking about. They will forget about you the moment the money has been collected. Sometimes people don't even call to say thank you. Right? So, let me finish by that. And I know it's heartbreaking because I went through that. So you will not be judged by the money you have been sending home. You won't be remembered by that. History will remember you. History will judge you by the legacy you built for Liberia. So, Mr. President, thank you for the opportunity to be here. And I want to assure you, with your government, all the colleagues in the room from the diaspora, that UNDP and the UN in general in Liberia will stand beside you to convene, to de-risk, and to co-create together. That's what Sylvia has talked about. But from our diaspora, for our diaspora colleagues, leadership must come from you. The UN is there to support, to work with you. And it's only in Liberia for one reason. There is no 2-3 mandates or 2 reasons for us to be in Liberia. The only reason that we are in Liberia is to support the government fulfill its obligation and then work on the priorities set by His Excellency and His government. We don't have a mandate. Our priorities, we don't have priorities in Liberia. Our priorities are the government priorities that we are trying to make sure that they have the implemented. So the opportunity, colleagues, is here. Mr. President, thank you. So the choice is yours, and the time is now, as I said. And thank you.
Thank you very much. And so, the pace and the trajectory have been set from Sylvia to Aliyu. The vital questions were asked. The Ethiopians are investing in Ethiopian Airlines. What direction would Liberian diaspora take? Mr. President, we have a very perfect response. And that response comes from a very hard-working Liberian entrepreneur, an astute and a consummate patriot. He is the President, Chief Executive Officer of the Liberia Diaspora Equity Fund. He will answer these questions succinctly. Ladies and gentlemen, popular demand, welcome Mr. Ansu Dualo.
Yes, thank you very much. Mr. President, Madam First Lady, government officials, distinguished ladies and gentlemen. I'm going to be very simple, and I'm so happy I don't have to rush this time. Because this means a whole lot to me. A lot of questions were asked about our country, And sometimes we laugh. I want us to get serious for a second, because these are serious times for Liberia. I ask this question every single day. What will be our legacy to Liberia? I know we're not here for a long time, and I really mean this to my core. I mean mortality. I'm talking about our mortality. We send money home, $800 million United States dollars. Just think about it. The Liberian national budget is approximately that amount of money. $800 million. And we have achieved absolutely nothing. I've spoken about this issue maybe some 6 years. I've continued to push about it and say, listen, what are we going to do to transform Liberia drastically? I'm not talking about putting silos. I want true transformation. In its very room, the average Liberian back home lives on approximately $700 per year. That's per annum. Every single person in this room, well, in these United States, the average person in this country lives on $50,000 a year. Liberians located in the diaspora, please include Australia, Western Europe, we have at least $20 billion capitalization. The entire GDP of Liberia is approximately $4 billion. We're not getting no money in Liberia. The money resides here. Are we going to build great big things in the country? We've launched the Liberian Diaspora Equity Fund. And I want to say a big shout out to the Liberians that listened to me when I first launched this fund. I hope Asiva took I was here, the Chief Executive Officer of this operation. The very first couple of weeks, over $100,000 came in, and Liberians are continuing to purchase their share. Just to cap it off, a share is approximately $100 per share. We cap it at 5,000 shares per person, because we want every single Liberian to contribute. The goal is to get Liberians to invest so we can build great big things in Liberia. When we talk about the agricultural ministry and the meager budget it does have, and the amount of money that we play with in this country, we are making no concerted effort to actually change what's happening in the country. Look, not everybody can go home, but everybody can go home, and I will show you how that is possible. We have engineers in this room, we have lawyers, we have doctors, you name every profession. Imagine them, they're sitting right in this room tonight. I can get them home. This is how we're going to do it. But I need you to join this effort. We have made the plea every single place we can make this plea. I want to go home. I want my expertise to be translated in Liberia into something I can feel, touch, and smell. I want the Liberian Diaspora Hospital. I want the Liberian Diaspora University comparable to any university globally. I want the Liberian Diaspora Bank, and this is how we're going to do it. I heard the gentleman from the UNDP speaking about how we can contribute to the country, what we need to do. This equity fund has 5 basic objectives. Primarily, obviously, we intend to make our shareholders money. Yeah, we want to make them money, and I firmly believe for Liberia to develop, we must create our own local millionaires in Liberia. Without question, we must create local Liberian millionaires. That's number 1, we must make our shareholders money. Number 2, the Liberian population, approximately 3 million people are of working age in Liberia. 3 million people, that's a voting population above the age of 18. All of those numbers, less than $60,000 people work in the government. Most people have to kind of live in the private sector. We can transform this through this fund. Number 2 is to create massive amount of jobs across the country. Number 3 is to build Liberian industry. In every single agenda that you listed here tonight, you spoke about the Ethiopians. Why don't we have the Liberian airway back in the skies? Why? And this is doable. This is not a complicated thing. The blueprint has already been written. We intend to raise this money. The money is being raised. But I need you to continue to join us. We took the website down last week. There are some modifications being done to the website. But if you're listening, I wish I was given enough time to give a proper presentation here tonight. It is Liberian Diaspora Equity Fund.com. LiberianDiasporaEquityFund.com. That's number 2, is to create massive amount of jobs in the country that we control. I'm talking jobs. Number 3 is to build Liberian industry. I want small scale manufacturing in my country. Look, most Liberians that live in this country, if you cook in your house and you cook toboggi, for those of you who are foreigners, how will you love it? It will cost you approximately $100 to cook that food. It is extremely expensive to cook here. But guess what? No Liberian benefits through the chain. And there is no job being provided in the country. We want a large-scale fishing industry across Liberia. Look, our position from Grand Crew, Grand Bassa, maybe into Maryland County, we want to build hubs in these locations. We can start maybe 5 ships to begin. It costs approximately $500,000 a piece for one of these fishing vessels to put men to work. Men must go to work to protect the Liberian family. Look, there's something I want to say here tonight that you guys may be taking for granted or not noticing. The Liberian family is being dissolved because we have no 2-parent household, no job, no man. Our children are raising themselves. We are losing an entire generation because most of us have fled the country. Number 4, I want economic control of my country. Liberia's economy is not controlled by Liberians. Our hand-to-mouth marketing has not worked. It's not going to change if we don't make the calculated decisions to change them. And the only way to change that, we have to pool our resources to raise this money. We raise the money. We go to Liberia. I want the first glass tower in my country. I'm sick and tired of being sick and tired of being called a third world country when we have the expertise to transform Liberia. Look, it is okay to go to the government. It is an awesome responsibility to be a part of government to transform your country. For me, I want to get in the gutter. I want to get in the gutter because I know in the gutter, this is where we can rise from. When I first went home in 2007, people thought I was crazy. I invested at first. It was $300,000. Big shout out to my wife. She's all the way in the back. She's like, "Where are you taking our money?" And I told her, I'm going to go clean some feces in Liberia. I was the first person that took porta potties to the country. I took giant tanker trucks to Liberia. And at this height, we had close to 27 employees. We were literally trying to transform feces into fertilizer. And we were trying to build something from the ground up. For 10 years, this was a toy. I learned great valuable lessons in Liberia. But I want to say this to you. If we do not stand up to stand Liberia up, she will be kneel permanently until we become intentional about transforming this country together. I am not saying this just to make this point. I'm saying this, you were fortunate to come to this country to impact Liberia, not to just transform your own personal life. The president can do everything he wants to do. And I'm going to say this. The president of the Republic of Liberia, you see the transformation happening in the country, the road connectivity, the hospital being expanded, the new schools are being built. But I want to say this to you, if we don't make calculated decisions to create jobs in the country, there will be a large portion of the population, I believe, the president failed because they did not have food on the table. So we have to help. And this is how we help. We pool our resources, we get Liberian experts to come in to transform Liberia through industry. And the way we do it is to pool our resources. Again, the time is not there, but you get the gist of it. Join this effort. Let's transform Liberia through industry. That's the only way.
I was glad when they said unto me, "It is Saturday." Thank you so much. I stand just to share with you what's going to happen for the rest of the time we have here this afternoon. We're going to go into our breakout sessions. Those sessions are extremely important to the organization of this conference. What's going to happen is that those persons who have signed up to be part of the health conversation will remain right here in this hall. We're going to combine the panel with the breakout to discuss the same things. I know our First Lady came purposely to be a part of those conversations, and it will remain right here in this hall. 3 other breakout sessions will be dismissed, and we will send you all to your various rooms. We're kindly asking that you remain seated until our president exits the room before you are dismissed to go to your various breakouts. I've just been reminded of the survey card that we give in order to improve future conferences. We want to hear from you, just how we survey you prior to this gathering. We want to survey you again to help us plan the next event. So I'm going to announce to you where you're going for your rooms. For those persons who are going to be part of the Building the Gap, the public-private partnership solution for trade and investment, you're going to be in the Capitol View room on the 14th floor in this tower. Those in the health remain here. Those that are going to participate with the creative economy, talking about stimulating growth through the arts and culture, are going to be in the Potomac View room, again on the 14th floor. And for those persons who want to further engage those young entrepreneurs that came up earlier under the moderation of Mr. Leo Johnson, we want to give you additional time with them. And those, again, who want to engage Mr. Ansu Dualo, you all would then be in the Jackson, Harrison, Wilson room in the South Tower behind the lobby. Right? You're going to have your 15 minutes to engage. You need to be back in here right at 5:15 because His Excellency is going to be with us to bring all of this to a close. We'll start promptly at 5:15. And so you need to please cooperate and be back in here because once His Excellency begin to give his closing remarks, we will not be allowed to enter or exit. So please let's cooperate. Ambassador, please. All right, So again, let me encourage you to participate in this breakout session. I'm going to stop here right now, and I'm going to ask those persons responsible to escort our president to please come and do so. Please remain seated as I have kindly asked you.
The town hall meeting tomorrow, the 28th at 4 p.m. with His Excellency, the President. It will be held at the Redeemer's Church of Christ, 10001 Aerospace Road, Lanham, Maryland. The QR code will be placed up there. You just use your phone and you get a direction. It's tomorrow, Sunday, 4 p.m. to 6 p.m. The address is Redeemer's Church of Christ, 10001 Aerospace Road, Lanham. That's Lanham. Lanham. The H is silent.
Maryland 20706. The QR code, please.
It is a presidential town hall where you will have the chance to ask the president direct questions. It's very important. The president will have the chance to get to hear from you directly, your view, your opinion, to help shape our country. So please, thank you.
So the QR code, please scan the QR code for directions to the town hall meeting tomorrow. Use your phones and scan the QR code for the presidential town hall meeting tomorrow. So the breakout session for the health panel is in this room. If you are going to participate in that session, please stay in here. All other discussions will be held outside. So the breakout session for health will be right here. So please stay if you are participating in the health panel and breakout session.
Yeah.
Hello? 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 All right. Yes, sir.
Folks, our healthcare conversation will begin in 1 minute. If you are participating in healthcare, please have your seat. If you are not, we will respectfully ask you to exit the room. Thank you very much. We will respectfully ask you to exit the room if you are not participating in the healthcare conversation. But if you are, we invite you to come up front and have a seat, and we will get started in another 50 seconds.
I'm live. Well, good afternoon, good evening, ladies and gentlemen. Thank you once again for joining us here at Arlington, Virginia. We're bringing you day 2 of the Liberia Diaspora Annual Conference 2025. This is being convened by the President of Liberia and the government, and the President of Liberia in collaborations with the Diaspora Liberian. So for now, they're taking a break when they break our room, so we'll bring you interviews from different individuals here. So make sure you're following us, make sure you're staying tuned. My name is Derek Yale, and I will be bringing you a live interview in this couple of minutes. For now, we'll bring you breaks, so just stay with us as we bring you all of these interviews we got here for you.
Participating, we respectfully ask you to come up front so that we can get started.
Break.
Attention all organizations, NGOs, and social clubs in and out of Liberia. Are you tired of relying solely on social media to run your operations? An effective web platform is your most important marketing tool, and that's where Tiamet.com comes in. Hello, my Liberian people. My name is Sophia, and I want you to consider this. 53% of consumers do online research about an organization before talking to someone from that institution. That means not having a website could be costing you opportunities. Step up your game and establish a professional online presence. Introducing our web platform, designed specifically for 501c organizations, small businesses, and political organizations, social clubs, etc. At Tiamet.com, we understand how important it is to make a great digital first impression, which is why we offer you all the help needed to develop, maintain, and host NGOs and small and big organization websites by giving you a full suite of services that includes automatic billing for members, membership and visitor portals, first-class design and functionality, and much more. The best part is, it only costs $20 per month. Upgrade your image today with our customized web design services. Visit www.tiamet.com to get started. This is a Liberian-owned business.
So we'll go ahead and get started. Let me introduce my dear friend and brother Joseph.
Good afternoon, good evening, wherever you're watching us from. This is the Liberia Radio and Television Network. My name is Derek Yale, and we're here in Arlington, Virginia, bringing you live coverage of the 3-day annual Liberian Diaspora Annual Conference convened by the Liberian government in collaborations with Diaspora Liberian. Here we have people attending from in the diaspora, the United States, Europe, some parts of Africa. So we have a host of Liberians here from different sectors or different regions of the world. And as promised, we're bringing you a lot of different interviews. We have with us one of the attendees here, Mr. Dwalu Bryan. So Mr. Bryan, welcome to the Liberia Television Network.
Thank you for having me.
You're welcome. Today is day 2 of 3 of the conference. So just give us, what is your impression? What do you make of the conference so far?
Well, I think this is a great start. For the most part, it's an opportunity for Liberians to hear directly from government officials, from businesses, and looking at what's available out there in terms of opportunities. Because we have a lot of Liberians outside with Liberian origins, and we need to, go in bold and take advantage of opportunities, and just support
There's a lot of great speakers out there today. Is there any particular speaker that you really enjoy, or is there something that was said during this program for the first time that really left an impression on you that you would like to share with us?
Well, I think a lot of speakers had a lot of good things, and I gravitated towards the last speaker because he spoke about artificial intelligence and technology. That's my background, and I look forward to exploring those opportunities because I have a special passion for contributing to Liberia, and in many ways, my family and I, and we just want to give back to society, and so looking at the opportunity to contribute in terms of training and bringing up technicians in the technology space will be a great start. I do have a couple of ideas that we can venture into and be just take an opportunity to give back to Liberia.
Yeah, this is the importance of this program. Now I have to ask you this question though: the president creating this opportunity for Liberia in the diaspora to engage the government, tell him their concern. How important do you think that is as far as integrating diaspora Liberia into Liberia?
Well, I think I heard that we do have a diaspora office, so that office will have to be a lot more active in terms of engaging Liberians here on a, I would say, regular basis to kind of like try to identify what our needs are. Because a lot of us go back home and feel disappointed and want to avoid that because there are too many Liberians out here willing to contribute, willing to go back in different areas. I mean, like, I don't want to talk about what I do because I keep that private, but I think Liberia has a lot of opportunities and we're not tapping into that. And so if we have the diaspora office that can create that space to encourage and motivate Liberians instead of going to the Caribbean and other countries to contribute, they can use that office as a conduit and be positively, an asset to Liberia.
Right, and not to hold you too long, you see a lot of Liberians here today from different parts of the country, and some are from Europe, some are from Africa. If you don't mind sharing where you're from, and just give us a final word on this interview, I appreciate it.
Well, again, I'm Dwalu Bryant, and I live in Maryland, my family and I, and in the state of Maryland. Originally from Liberia, of course, for many years, and I work here. Don't want to disclose my.
I understand that. Just
what I do, try to keep it as private as I can.
Right.
And it's a pleasure to be here, and I look forward to engaging the opportunities.
Okay. Thank you so much.
All right. Thank you very much. Appreciate it.
In our community, we help each other. But when it comes to prescription pain medication, such as opioids, sharing isn't helping, it's harming. What works for you could be dangerous, even deadly for somebody else. Don't share your opioids. Instead, help by guiding your family.
No, come on, if I will bring your chair. We'll put your chair on our head. Yeah. You wanted to bring the president chair for you? Oh. Come on, sister girl. So one of the things that I like to, actually what we should do very briefly is go give each person an opportunity to self-introduce, right? We've rehearsed this. Each person will say, my name is, this is what I do, and this is how I'm engaged in Liberia. 3 short sentences. As soon as they go above that, I'll take my microphone back. Good thing we got, they ain't got their own microphone. The microphone belongs to me. All right. So, Mama, you already talked earlier.
My name is Memazi Ibari. In addition to being the Technical Assistant at Ministry of Health, I am a registered nurse here in the U.S. I do work for a managed care organization in North Carolina. I also have a charity in Liberia. My focus is on young kids and young adults. Okay, so during every holiday, I also feed people. I help pay medical bills. If people need to be fed, so there's challenges. There's so many things you can do to help. So, that's pretty much what I do. Okay.
Good afternoon. My name is Grace Kalasua, and I have worked 30 years in public sector, local, county, and state. And my work has been rooted in systems change, behavior health, social change for children and families. And mostly I've emphasized in community engagement. Part of that has allowed me to help my local organization, Liberians in Columbus Incorporated. And I'm so glad and honored to be here to share some of my experiences with you.
Good afternoon, everyone. My name is Goma Kole Gwaji. I'm a bold Liberian investing in Liberia. I'm a businesswoman out of Denver, Colorado, Aurora to be specific. My husband and I run small businesses there for the last close to 10 years. We also have a health facility in Grand Bassa County, Liberia, that opened up on May 5th of this year. We were fortunate to employ about 44 Grand Bassa residents, thank you, including PAs, nurses, nurses assistants, custodial workers, the whole works. And we're building that mission to build a bigger hospital in the next 5 years in the same area. Thank you for inviting me.
Good afternoon, everyone. It's a pleasure and honor to be here. My name is Jacqueline McKay, and I'm someone who works, with a diverse background, but particularly I'll be talking, since I'm talking about health, I'll just be mentioning more of what I've been doing in the health sector. Worked for several years in the health sector. And also, I am a founding member, co-founder of the National Public Health Institute in Liberia. One of the many hats that I wear, and some of you know me from the media as well. I'm a project manager, entrepreneur, financial management background, and most importantly, what I enjoy apart from being a mom, I'm a philanthropist, and I really enjoy doing that and helping others. So like I say, it's a pleasure and honor to be on this platform today to discuss health and health investment. Thank you very much.
Hi, my name is Carolyn Bindu-Moore, and I'm a robotic cardiothoracic surgeon that works out of central and western Pennsylvania. I also have my own LLC, More Medical Education and Consulting, where I focus on folks with disadvantaged backgrounds that go into graduate medical education, and those backgrounds, and we help them through the process of being a person, a minority in that type of community, and trying to get through the process in the best way as possible. I am a servant of God, I am a servant of our country, and my goal is to give back in the best way I can to Liberia, because that's the way I was raised, and I'm happy to be here.
Hi, my name is Dr. Lawrence Zuma, a neurologist with high qualification in psychiatry. I have been engaged in Liberia for about 3 decades. We've done several things. My wife and I, she's a realtor, so we invested here in Liberia. We have a clinic in Liberia, started in 2020. We have expanded to Bassa, the Center for Epilepsy and Neuro Disease. The website information is out there. We do teaching and help residents from Liberia to come here and try to do what we can to elevate the standards. So we involve at different levels. Thank you.
Good evening. My name is Masa Talawali. I live in Columbus, Ohio. Ohio's in the house, represented. Woo! OH! Bingo. I am a registered nurse. I have been for State University Medical Center. I'm also a doctoral student for nursing education. I spent many years in nursing education and I still do that. However, I'm currently a nurse manager. The first time I went back to Liberia after the war was 1998. It was then that I knew I needed to do something. And since then, I've been on the road, boots on the ground. One of the last trips that I took to Liberia was more of a calling, was during Ebola. And Liberia needed us. And Liberians in the diaspora were not going to Liberia to do Ebola care. So I signed up with International Medical Corps and I went to Liberia doing Ebola. I work in ETUs, I trained, I went all across the country, Liberia, Sierra Leone, and we did a lot of great work. So as you will hear from all of us here, we have been on the ground. So what we bring to you today will be experiences that we have had.
Good afternoon. My name is Dr. Aja Asaka Kamara. I am a primary and psychiatry nurse practitioner. I'm the founder and owner of NIMBA Integrative in Atlanta, Georgia. I have been with the Liberian Medical Mission since 2011. Today I am not too happy because we are talking about health, and the fact that we left that at the end, dead men cannot invest, dead men cannot be running businesses. So we're talking about health. It's very, very important, but I understand due to the planning. So I'm one of the providers that get to check all these blood pressures. I've been to Mbans, Saclay, Sanipole. I'm the one that usually dealing with blood pressures in the 200 and plus. So today, our reason of being here, how can we prevent? We don't wait. Dialysis in Liberia is $1,200 to $3,000 a month. It's impossible. So why are we waiting to get there? So that's why we are here, to find a way to save our people. At the end of the day, Liberia is all we got.
Well, how can I go after my big sister? I'm just banking on the people that know me in the crowd, but I'll do my best. Listen, my name is Dr. William Etta Simmons. I'm a licensed clinical psychologist. I am, as they mentioned, the Director of Mental Health Services for Liberia Medical Mission. I'm also the owner and Executive Director for Integrated Psychological and Consulting Services in Ballard Kenwood, Pennsylvania, and the President for the Pennsylvania Psychological Foundation. I wear many hats. All right, and today I am here. I've been a member of LMM since 2013, and we have faithfully served every single year. I just want to add that in 2020, when no one wanted to go to Liberia because of COVID, I risked my life and many others to go. And in fact, we took the last plane to get out of the country before the country was shut down, before America was closed. But investing and serving is very much in our blood, and I'm grateful and truly honored to be here and to continue to serve. Thank you.
Hi everyone, I'm Dr. Chiva Major. Excuse me. I'm principal of iInnovations in Drexelville, Pennsylvania. I have other businesses as well. Nourish RX, where we have an integrative wellness spa that I own in Pennsylvania as well. I'm a board certified, fellowship trained optometric physician. My areas of specialty is eye disease, integrative medicine, functional health, and pediatric and developmental vision. So as you've heard, I am the director of eye care programs for the Liberian Medical Mission. I've been in that role since 2013. And our role here is to educate you on some of the real experiences on the ground. There's a lot that's being proposed from a ministry. There's a robust agenda, but it doesn't always parallel what we're actually seeing on the ground. We need the help from the diaspora to kind of empower us and give us, kind of bolster us So when we're on the front lines, we know we have your support because there's a lot that we're trying to do. Preventive health and saving the lives of Liberians should be a top priority for everybody, but it's not. And so hopefully we can share our experiences. We've had a lot of challenges, but the goal is to keep moving forward and to see each Liberian in a holistic way. Let's not compartmentalize them into pieces, high blood pressure, mental health. Let's see them as whole individuals. And how can we collaborate? You know, we have a great group of experts, but we are representative of all the people in the diaspora who are trying to help Liberia. We have the expertise, we have the willingness, we're paying for ourselves, we're self-funded, and we're getting a lot of pushback. So let's dialogue through this and see how we can collectively support Liberia and uplift our country.
Wow, what a group of experts. I mean, think about this. When we talk about Liberia is blessed, here is a sample of what we mean. And that, I'm not even talking about the rest of you, because if I pass this microphone around and listen to you and your expertise and your skill sets and your experiences, Liberia is blessed. There is absolutely no excuse for our country to be the way it is when we are what we are. What's the excuse? Well, let me add to that because I didn't introduce myself. My name is Yakasa Peter Pei. I'm a senior project officer. We call ourselves public health advisors at the U.S. Centers for Disease Control and Prevention in Atlanta. Like two of the sisters here, I too had the opportunity to deploy to Liberia with the U.S. government to respond to Ebola, and I spent 9 weeks over 2 tours responding to Ebola in Liberia. That was the time of my life, because as I work alongside my American colleagues, they could see the emotion and the tears in my eyes every day, because these were my people. My blood is the same blood that runs in their veins, and we were there. I mean, I'm just a Firestone people. And actually, I also run a nonprofit in Liberia. We operate at an intersection of faith and public health. You know, as I talk about the need for prevention and prevention and prevention, and that's really where it begins. Prevention. An ounce of prevention, they say, is better than a pound of cure. And we need prevention. Let's see if our video is up. Is it? Okay, so our video looks like we didn't give it meat and whatever we ate today, we didn't give some to the meat. We give it salad. The video is still feeding on the salad from yesterday. So it said, you ain't giving me today, I ain't coming home. So the video is not coming home. Sorry about that. What we'll do instead is we'll just talk. We got the PowerPoint. The PowerPoint can't come on. Oh, but yeah, the PowerPoint will come on. Something got to come on. The PowerPoint is coming on? Okay, then let the PowerPoint come on. The video can come on too? Oh, but then we finish giving me and put it to let the video come on. The video first. Yeah. Yes, there will be a question. Let's watch the video. Hold on, let's watch the video, and then we'll come to question. I know we don't have a lot of time, but while we wait for that, I told you that the salad from yesterday. Let's take a couple of questions. Sorry about that. We'll get to it. What is it? That's we can't hear it. Okay. We can't. Okay, we'll come to you. Yeah, sorry folks, we just have to proceed without. because let's wait and see the PowerPoint will come on, and then we can proceed with the PowerPoint. We're terribly sorry. Trust me, we'll do this and we'll take a few questions. Okay.
I'm not the moderator here, I'm just part of the panel. Okay, so beginning my day job, I'm a director of nurses at a MCO in North Carolina, so I'm a registered nurse. I believe there are some nurses here in the audience as well, right? So I think, because they're saying that, if you can ask questions, because I don't know whether it's going to be partnering with you, or because I want to make sure that everyone listens to the presentation, because I would like to give. So I would like to give an email address that you can reach directly to the ministry with, because it's difficult let's look at our population and trying to reach the minister. So we do have a mailbox that you can get to that is triaged by about 7 people on a daily basis that we can get back to you. And it was on my presentation, but there was a limit as to the time that I was given. So I want to make sure that I do give that out. It's moish.mdu24@gmail.com. moish.mdu24@gmail.com. If you follow me on social media, you can also follow the Ministry of Health on social media. I am on all social media platforms, okay? But if you follow me, you can also just reach out to me. My other email address is just my name at Yahoo or my name at Gmail. Because I want to make sure that you get the information that you need, okay? All right, thank you.
Sorry, we're just in the interest of time, and while we do that, we'll take a question. I know we saw a hand here. I'll come in the back to you, but let's go with Dr. Brunel.
Thank you.
Yeah.
Thank you for all of our panelists, for all you do. I'm Dr. Lincoln Brunel. I serve in the Maritime Communication Program. And at this point in time, I like to say, I just returned from home. I lost my 35 pounds. So I want to ask Patricia, how can we come up with a program on what I call noise? I also have a question on how we can almost 300,000 to 350,000 young people who are using drugs as we speak. There's also garbage pollution. And we have other pollutions that we can barely speak at. I was home for about 6 to 8 months serving in villages, and I could barely sleep for 3 or 4 hours every night because of what I call noise, garbage, and drug pollution. So how can you all help?
Answer that question.
Yeah, sure.
Yeah. Okay. Yeah, so basically 3 things. You have to go what they call the decibel limitation. England has a good program. We can give more details on that. Garbage pollution has been a national policy. The Guineans and the Germans have worked together a very good policy. Because of time, I can't give you more details. The issue has been 3-pronged blitzkrieg. You have to criminalize the pushers. Those who take the medication, you have to treat it online basis, depression, all that stuff. But I will suggest in this forum that they have to introduce the death penalty for drug dealers in Liberia.
Okay. All right. In the interest of time, I'm going to do some of our solutions. We're going to do some of our solutions to some of the things that we're going to talk about during this discussion quickly, and then move forward from there. So there's one thing I want to do before this is we talked about the many people in the Liberian diaspora. Richard Appleton, if you could stand up for a moment. He is creating Liberia's first electronic medical record. So I'd like to give him an applause for that. So he's in the room. All right. So what's in the pipeline? So we're going to address some of the problems, and so we're going to move through some of the solutions for this. And so we are working on, now this is Just One Door. So we talked about maternal child health. They're an organization where the CEO is Dr. Margaret Larkins Pettigrew. She's out of Pittsburgh, Pennsylvania, one of my mentors from medical school. And she has this organization that has sustainability in Guyana. They're out of Ohio too as well. And they create functional programs, sustainable programs to teach the youth and teach them, educate them about maternal child health. They create fellowships for people into training so that they can go abroad and get trained in the U.S. And she wants to bring this to Liberia as well. So this is Dr. Shanita Johnson. She's a professor of global health. She's at Meharry Medical College and is the dean, the vice dean, and the chair of surgery at Meharry Medical College in Nashville, Tennessee. She is a robotic general thoracic surgeon. She is one of my mentors that trained me in general surgery at Morehouse School of Medicine. She is ready to partner with us now that she has moved to Meharry in the School of Global Health to work with us on many, many collaborations that we have, and the collaborations are vast. And this is important because Tennessee is one of those states where international students can get graduate medical education and some form of education in the States. And this is important for us because we can bring Liberians to the States and they can sit in the classes and take medical school classes with Meharry. And so clap for that. Right now, they have 10 seats at Meharry that goes to international students. And Liberians can be one of those 10 students per year that get educated in the United States. So if it's not, it has to be we, not me, in their process. And they have already started and said they are willing to collaborate with Liberia. So the Ministry of Health, they want to partner with it. So they're pleading actually to us so we can do this because they're ready to go right now. So their vision, our vision is to make health equities in history. The mission is to empower leaders and catalyze solutions in the world most pressing to the complex health challenges. This is their board. And there's so many people on their board, but there are some prominent people like Dr. Satcher, who used to be what, as you can see, he used to be general. So there are multiple people, and all those people are in agreement now to do this. And so a lot of these slides we won't go through, but these degrees, PhD in Global Health Equity, if you see them all on the board, they do that in Nashville. That means Liberians can get those same degrees as well. Okay? So the keys in the collaboration is policy analysis, health systems, legal epidemiology. All of these things are the ways they believe they can collaborate with the ministry to do this. And they are shown that they've done this before, so they have a history of legacy to do this in Rwanda, Brazil, Kenya, South Africa, Zambia, and Malawi already. So why partner with them? And they're asking us to partner with them to do this. And these are the reasons that they gave to partner with them. And this can be joint programs and many ventures, as you can see here, co-developed certificates, policy, political determinants of health, moving, so on and so forth, policy making. And as I said before, they have exchange programs already with other medical schools, and that will apply to Liberia if this were to work. So they go through the immediate steps to make this work, and additional collaborations and opportunities. And this is her contact information, and she's ready to go when we are. She said thank you.
All right, let's take we had a gentleman, oh, he's left. So let's take a question up front. Right here.
Good afternoon. My name is Amelia Toba, a registered nurse manager from Atlanta, Georgia, and president of the Liberian Nurses Association. My question is particularly for Mrs. Kenny and her team. My concern is licensing and regulations. How do you plan to mitigate these issues? Dispensing of drugs, but illegally dispensing of drugs by pharmacies, for example, expired drugs. And then the second question is, how do you also plan to mitigate the fact that there's a prevalence of unlicensed professionals that are out in the community and rendering healthcare services?
So I apologize, I was a bit distracted. Can you repeat the first one, and then I'll address each. Okay. Go like that.
Pharmacies that are dispensing illegally, and an example is expired drugs. And I'll give you a quick experience. I went to the pharmacy. I had and not to be funny, I had a 10-year-old Indian child prescribe me a medication for me. That was concern for me as a healthcare professional.
I'll address that first. Okay, so when Minister Poto took over, she did tour the entire country. This is not a new issue, but it's a continuous issue that is being addressed. So if you're on the ground, you can close one place, and then you go back to another and open it. So that is being looked at. Okay, I know that she's partnered with not necessarily LTEA, but with the police. Okay, there have been some arrests. Okay, the other thing that happened is when they get these people, they also end up leaving the country. So the issue in Liberia is not going to be resolved immediately. We know that this is a new government, okay? However, these issues have been going on for even back to Madam Sirleaf's government. And so we have, I would say that some are under control. The other issue is it's a lot of mom and pop or pop-up pharmacy, drugstore, in the country. You say you noticed that. So there's some like Lucky Pharmacy. There's some pharmacy that are recognized that the ministry will send you to. Some are being closed. There are some arrests going on, but they have to people have to be given due process, and all of this is going to take some time. So what was your second question? I hope that, and you know what, Amelia, I know we must be in some chat room, but I can take that back and get back to you. I gave you the email address. I would love to partner with you because this is why, I help because it's our country and it's one country and it's so much work to be done. And that's why I in my presentation, I said we want to partner with the professionals because one person don't have all the answers. Maybe you might have an idea how we can control that. That is open, to look at and acceptable. So we look at that and see if we can create processes, okay, and stop that. But, people come in, it's difficult, when you arrest one person, close one shop, they open another. It will take some time to curb this behavior, okay? These are behavior that's been going on for over 20 years. We're not going to stop it completely in 2 years' time. What was the second question?
It's okay. I know. Let's do this. Sorry, Amelia. Let's do this. I see all the hands, and I wish I could get to all the hands. But let's do this first. I want to go, with all due respect to everybody, right? These folks have spent the last month preparing their thoughts. You're on your own people, all right? And I've already said I'm going to embargo this. Actually, I should put it in my back pocket, right? So you won't hear anything here. But no. Hold on, sir. What I want to do, let's do this. These people have prepared for a whole month. They have some thoughts. I will give 3 people 1 minute to share highlights of their thoughts about solutions, right? Solutions. As soon as somebody starts to talk about problem, I'll take my microphone back. I want to hear solutions, right? So we'll take 3 people, 3 minutes. Then I will come and then we'll take 1 or 2 questions, then we come back here. Hey, fair like that? We can't hear. La Liberia, we ISO, you ISO. No, I don't like that one. Okay, so let's start here.
Hi, specifically my area of expertise is eye health. However, one thing I want to highlight is that 60% of the people who present for eye-related symptoms have undiagnosed chronic medical conditions. So the eye clinic and the screening is the critical entry point for for referrals into the overall healthcare system. Basic recommendations that we're making: 1, integrate eye health into systemic health. 2, shift our missions in our agenda with diaspora collaborations from only short-term service delivery to hybrid models where we can actually impact and empower local providers. That includes mentorship, use of telemedicine and technology to strengthen local capacity, and to also ensure that the trainings that we're actually implementing are actually transferable. Third is to acknowledge the challenges that we're encountering, right? What is that? They're both infrastructural, logistical, and systemic, meaning electricity. We had incidences where we're doing surgeries and the electricity got turned off, okay? Where we're having to use our cell phone flashlights to see patients and screen patients over 6 to 8 hours because we have no electricity. The systemic issues have to do with policy pushback and inconsistent support from the folks on the ground, Ministry of Health included. So these are challenges overall that, like I said, there are gaps, but there are easy fixes to this, right? We can have formal agreements with the hospitals, MOUs with the institutions that we're partnered with here in the diaspora, because we want to have continuity of care. We want to ensure accessibility, because that's the key area in prevention. People have to have access to care. If nobody is checking, people are dying from things we can prevent very quickly. Last but not least, we need to have a diaspora-related non-governmental healthcare task force that would align the resources, the priorities, and the policies so that we're building trust, we're enforcing sustainability, and we're building a stronger healthcare system.
Let me put my weight on mental health. Thank you, Boo. Because we do know that there are lots of other physicians on here, but mental health is an important issue in our country, from the top down. We are incredibly traumatized, and it shows. I know he said don't talk about problems, but it's hard not to talk about problems when you enter into Liberia. What you're faced with is mental health challenges from the jump. So let me just jump to some possible solutions. One of the things that I think we've made some progress in, but continue to need progress around, is destigmatizing mental health. Okay? Everything I will put in our Liberian English. Now wish, now because you went to your mom's village and then you drank that water and that what it happened for. Now not everything. So it has nothing to do with all that extra stuff. Sometimes it's simply that you truly have a mental health challenge, right? Or mental health issues. All of us at one point or other have experienced some mental health challenge at some point. If we're being honest with ourselves, right? Myself included. So what I would say is, number one, destigmatize it. Public health campaign, strongly destigmatizing that piece. The other thing, having gone to Liberia now for about 15 years on the ground, one of the things that I have seen that is a little bit problematic is, listen, we have a handful of psychologists like myself, maybe about 4 now, maybe possibly 5, serving a country of over 5 million people. In my state of Pennsylvania alone, there are 5,000 plus psychologists. That's not including mental health professionals, X, Y, and Z. I'm bringing that point out to say we need to be able to have train more individuals that will be able to meet the needs. You don't have to be a psychologist, you can be a lay person. My final point really quickly, it helped to talk fast in Jesus' name. You will not quench what I have to say. The third point that I want to make is that it's important that we actually have psychotropic medications on the ground. I have gone into many hospitals and they'll say, oh, we have to mix more Benadryl and put something else together to get a pussy, and the person is actively experiencing psychosis. So let's be real about ourselves. Numbers is one thing, but real life experience is another. Thank you.
At this point, I have nothing left to say. Okay. All right. Well, first of all, before we talk about Liberia, how many people here will tell me that they checked their blood pressure this week Let's start from this week. Put your hands up. Okay, what about this month? So you see, it's not strange for me to go to Liberia to see blood pressures in the 200 and blood sugar in the 600, 500, and they are telling me, oh, I got no problem. We are the first one to tell them. So for me, I'm looking at the simple way it has been done in Liberia. We can do it. Let's use community healthcare workers. We can pay them $100 a month. That would be like $15,000 a year. Nimba Kante Elu, I already got my friend here, Amelia, with it. Okay? So to make sure, before we be talking about stroke or heart attack or dialysis, let's not get there. Don't get there. But now, we all these issues, people dying day and night. For Madingo and Muslim, we can say, oh, God made the death easy for that person who didn't suffer. He died early morning. Let's not get there. So for us, for me, my goal is that we can start from 3 counties and pilot that to nationally to make sure we can take care of it. Thank you.
Thank you so much. See, that's why we needed to hear from them, right? And she said, I shouldn't quench the Holy Spirit. All right, let's take one question from this side, then we'll work our way here. Oh, my assistant, my big brother.
Thank you. Hello, everybody. My name is Miata Dennis Kruma, and I'm a respiratory therapist in health management. My concern here is respiratory care. It's the first function of our bodies. I was in Liberia 2 years ago. We attended a conference, and I asked a question. I said, what happens to a little girl or a boy that is in the interior that comes up with asthma attack? And this man, the question was not answered, but this guy told me, he said, he said, he died. And I see on the panel here, now one respiratory care. I listened all day today, no respiratory care. So my question is, the first function of our bodies, what happens? Nothing. People die, they don't have oxygen. Simple thing like oxygen, you die. When you're taking care of this or that. What happens? Solution to respiratory care. Thank you.
Okay. Yes. Let me start with probably Masa, if she wants to chime in.
So just to answer your question, the Liberia Medical Mission Team, we only have few of us here, but we have a huge group, and in that group, we do have the respiratory therapists that we take to Liberia with us, and they're able to help in some of those things. But there are not any on the ground in Liberia, and that is a challenge.
Let's take one question here. Oh. Yeah, okay. She was next.
I'll make it as quick as I can. Hello, everybody. My name is Chanel Stryker. I'm the co-founder and executive director of the Georgia Community Doula Coalition in Georgia. I'm also the founder of Liberation Birthways, which is a cultural, immersive, and birth justice journey that will be happening in Liberia in November. I'm bringing maternal health professionals from the United States to Liberia to help and hopefully collaborate with the Ministry of Health to help with the maternal health solutions. We've done a lot of work in the United States to improve maternal health outcomes, specifically in my state of Georgia and across the country. My question is that, a comment and a question, So what I've identified, and through my studies and learning about the maternal health system in Liberia, is that it is heavily being modeled off of the United States. And if in the United States, we know that it is inherently racist, and it was founded on black women, on the studying of black women's bodies. And so if we are having, wanting to keep the care in hospitals, encouraging women to come into the hospitals, what do we think is going to happen with the system? And if we're tracking the data of these deaths that are happening, I don't think those data statistics are coming from the rural areas, it's coming from the hospitals. So it means that the deaths are happening there, right? How can we bring and support the community-based solutions, the trained traditional midwives, and the community health workers to be able to support this thing that is not an illness, it's a natural thing, and women have been giving birth for eons without any support? How can we put, line item in the budget to pay the trained traditional midwives and community health workers to be able to provide the essential support to moms and babies? And how can I partner with the ministry to do this work?
He's telling me to keep it short, so to be fair with you, I think it would be great to partner with you. When I get off the stage, I'm going to come to you for your contact, okay, and we need to have that conversation because there's limited time. Because I can't answer that in a short time, okay? All right.
So, unfortunately, I gave up me today. I was say, whoa, I think so. Unfortunately, the president is on his way. So we are done. No, don't go yet now. So we'll allow my dear brother Joe to say how you can contact them. Liberia Medical Missions, right? Most people here are from Liberia Medical Missions. The rest of the folks will be around. Reach out to them, tap them on the shoulder, get their contact information, right? And then Dr. Zuma will close us out.
Thank you very much. Very simple. We need all Liberians to go to Liberia and build it. Let me give out to Dr. Zuma to make a closing remark. Thank you.
Thanks so much. It's out of time, but I think in Liberia to make some medical change in Liberia would need, in the medical system, would need structural reforms and mental reorientation. We recommend just one recommendation that the diaspora can help by being 50 with the Liberian Medical Association, trying to vet those who become licensed Liberian doctors, because the case of Peter Michael George is atrocious. Thank you.
Thank you, everyone, and so sorry to the panelists who couldn't say anything, but let's put our hands together for all of our panelists. And thank you, audience.
To promote gender equality, protect children's rights, and support vulnerable populations, including persons with disabilities. But what are the new directions the ministry is taking and the inspiration thereof?
We have had this talk about the Ministry of Gender being a more workshop-driven kind of, and coming in reality with the everyday human issues of our communities. I got inspired to ensure that whatever we do at the ministry should trickle down to the we have come to serve.
Please have your
At
seats.
the ministry, we come in contact with the people that we serve is to establish the 116 core platform that brings our survivor in contact with us, gives them access to us, so they are able to communicate some of the issues that confront them on an everyday basis.
So this is the National GBV Call Center. What we do here is we get calls from the communities. Sometimes there are calls around GBV, there are calls around persistent non-support issues. And what the team does is that they get the calls, we build a file, and then we refer callers to the different services that we have. This is one of the infrastructures we have that we're using as a government to fight GBV.
It takes a significant portion of our work. The cases are reported, and our mission with them is gathering initial evidence to go through the process of interrogation and investigation through the referral pathway. So social workers are dealing with the files to be able to provide immediate response. But then subsequently, there will be prosecution when there was a probable cause for somebody to be held for any crime committed.
Beyond the call center, we have been able to use the information that we generate from there to design interventions that meet their needs. And there are many other projects we call our flagship projects. The Street Children project that we officially call Save the Future project. They kind of impact the results that we see, kids being removed from the streets and how they've been transitioned back to a better and dignified life is something that I can sit back and reflect and be grateful. Also with the realized social care transfer that's under our supervision, and listening to the testimony that comes from the communities, our lives have been transformed, and how people will just talk about the impact of the small amount, the minimum amount that the government provides to them, and how it has been able to address some of their everyday problems, is something that I am very much thrilled about. And looking at the Women Empowerment Project too, the one, that is intended to reach out to many women, looking at health, sexual and reproductive health, empowerment of different kinds, reaching out to small businesses, helping women to grow their own money, and so on. One of the things that we see as a milestone is, the transfer that we made and how excited they are, and looking forward to what kind of transformation that, the small grant that we are providing to women in the 6 counties will bring to them. And given the fact that gender-based violence is rooted in women's inability to source funding for themselves and be able to self-care.
Ladies and gentlemen,
the government sees it's very important.
Please,
to invest in money.
If you may have your seats. His Excellency the President of the Republic of Liberia is on his way. We encourage you to be seated and quiet, please. To those in the back, please take your seats. We are trying to make way for the recap and the insights and solutions and recommendations from the breakout sessions from yesterday up to today. We are trying to work a way out where we have a 1-minute report of what have been the recommendations
you, ladies and gentlemen. That always works. Please, thank you so much. That always works. We'll resume with our press and information secretary. Alto, where are you? Please continue. Ladies and gentlemen, I think you heard us announce a few times, if you plan to attend, and you should, the town hall tomorrow, it will not be here. We will post it once more. Grab that QR code so you'll have the information where it is. It's in Prince George's County on the Maryland side. So please note that information, grab your cameras out so that when we do it again, you will have it. Okay? Thank you much.
Are you there?
Do whatever you were doing, continue going.
So representatives of the various breakout sessions, designated speakers who are representing those groups, we are trying to get signal, and once it is confirmed, we'll have a representative come out here and give us your solutions. We'll try to make it 1 minute each. We know the discussions have been very hectic, very in-depth. For some discussions, time constraint has forced you to cut short, but I know you have arrived at some solutions and recommendations. Once the VIP is seated, it will be an opportunity for him to listen to you. If according to protocol he's supposed to listen to you, that will happen. If not, the rest of us will listen to you before he comes in, but we're waiting for confirmation from the organizers of this occasion to see at what point in time you have to mount this stage and let us hear your recommendations. I want to thank you all for all the time you put in at this problem solving, brainstorming. It is my hope that after all this work, we will all internalize the solutions and then practicalize it. Let it not be like before. We've had several symposia, several meetings, several conferences, and we talk with so much passion, so much exuberance. But when it came to implementation, it was always a challenge or a flop. And we all challenge ourselves this time that this diaspora conference will produce sustained, achievable, recognizable results. So I'm cautiously optimistic, and I want us all to commit ourselves that this will be a fruitful encounter. Our speakers have been very inspiring, very motivating. I don't know. But again, the town hall, presidential town hall, it is hoped will provide one-on-one direct engagement with the VIP. Because I know everybody will have a question. It will have to be structured in a way that will accommodate your concerns. If it is required that you write your questions, if it required that you form a queue, if it required a hybrid intervention, we will do that. But as of now, the program has been worked out to see what we can do to accommodate all your concerns. Time is of the essence. If the program starts at 4 o'clock, we encourage you to be there by 2. So the address is Redeemer's Church of Christ, 10001 Aerospace Road. You're waiting for me here. Lanham, Maryland. say lay. Okay. So you see, if I ask the guy to pronounce P-L-Y-M-O-U-T-H.
Merci.
Huh? Why not Plymouth?
Okay. This is good. What's up? I didn't know.
Okay. And so it was like, yeah.
I see. Yeah, well.
L-I-S-T-E-N. Great. O-F-T-E-N. Huh? Huh? Often? Okay, so it's often. Often. Off and 10. So commonly mispronounced words. V-E-R-B-A-T-I-M. Huh? So you hear some of our scholars saying verbatim. So the word is verbatim, right? And so the next word is D-E-B-T. And debt. Okay, guess what? Debt. Then the next word is W-E-D-N-E-S-D-A-Y. Oh, now Wednesday. And I tell you, so S-A-L-M-O-N. I want high. Salmon. Salmon. So the L is silent. Now, W-A-L-K. W-A-L-K. Walk or walk. Okay, that one is salmon for you. So now you see, back in them days, Liberia, and today Liberia, right? There's this word. Even the journalists struggle to pronounce it. P-R-O. Yeah? Is it prayer? And some will boldly say prayer. I mean, a prayer or a prayer. It's prayer. Teachable moments. I know the doc is enjoying this moment. So like I told you, on this day, you see, on this day, the colonists in 1846 declared themselves free from the shackles of the American Colonization Society. And then, in a referendum, they voted that we'll be free from the ACS. Because the little territory called Liberia was funded by the ACS. What is the duty of the ACS? American Colonization Society, right? So the colonization is supposed to colonize, right? So we often say Liberia was never colonized. Okay. So since you were not colonized by American Colonization Society, your first flag had 13 stripes. What is the meaning of the 13 stripes? If you were not colonized, you had 13 stripes, just 13 red, white stripes, just as the American flag. The 13 stripes stand for the 13 original colonies. 13 stripes on your flag when you were founded by the ACS with a blue canton and a white cross. What was the meaning of your 13 stripes if you were not colonized? So your governor was he white? Was he appointed by the ACS? Or the sponsor of the trip? Who paid the governor? Who paid the governor? Who provided the currency, the books, the schools, and everything?
So, proud Liberians, we cannot search our history. Great. Great. Okay. So, great. So, then we had a referendum to declare our independence, our break away from the ACS. Why did we do that? Oh, you should have formed your own government? So what government did you have before? Oh, you did not have any government? Okay, so Jihudi Ashman was your first governor? Jihudi Ashman. No, oh yes, of course, right? Then you decided to say, okay, Jihudi Ashman, we don't want the ACS to be appointing governors for us. We want to appoint our own governor. Exactly. So Junior Rama became the first black governor appointed by the ACS, right? So you had that referendum. In that referendum, you spoke loudly that going forward, we are going to be free. Before you declare your independence, mind you, you declare your independence the next year. But for now, while we're thinking about that, we want to make some announcements. And we'll have Amaro make some announcements. We'll come back.
Al Jerome has a way of stirring of things. That's good. Hey, ladies and gentlemen, I think we've got some good information for you. I don't know. I know you've been moving around the building, north side, south side. I don't know if you didn't. And on this level, north building, did everyone get to go by the displays? Did everyone get to go by? I want to urge you, if you can, go by and see artifacts and things made in Liberia. One of the things that are there is this. And we're asking you if you didn't get one. It's only $10. This will be a memorable souvenir to take with you. So I think they have enough supply. So see if you can get that. The next thing is tomorrow morning. Tomorrow morning, Shiloh Baptist Church, Washington, D.C. The president will be worshiping there. Shiloh Baptist Church is the oldest African American church in the District of Columbia. I believe it is. Huh? 19, okay, good. Well, it's one of the oldest. Okay? It's one of the oldest. But here's what I know for a fact. Its current pastor is a Liberian. And that's where you get the opportunity to worship tomorrow. The president, His Excellency, will be in attendance. But y'all want to know the big news? Your chairman of these events, Ambassador Reverend Dr. Emmett Dunn, will be preaching. Now you got to come for that, okay? You got to come, and I'm telling you, the church seats 2,000, so they'll have some room for you. Now, follow the church, and you not in the mood of driving, there will be a 55-seater bus that will leave here at 2:45 to transport who wants to go on the bus to 1001 Aerospace in Lanham, Maryland. That bus will leave at 2:45 if you choose to take advantage of that. Amen? All hearts and minds declare? Now I got the best one for you. I know y'all been sitting long. Y'all had some all kind of food, right? But this evening, last night a few of us got to go to the Contemporary, and I'm gonna tell you, their wings were good. Okay? But the Liberia Diaspora Annual Conference 2025, an evening of community connection and celebration. That's tonight. September 27th, the venue is the Miracle Center Hall. That's a little ways up Drive in Laurel, Maryland. We'll post the information for you if you want to write it down. That will be at 7:30 this evening. In Laurel, Maryland, you get a chance to socialize and eat some Liberian food and what have you. Whoever would like to take advantage of that, that's available. Come and let us celebrate the successful brainstorming and sharing of thoughts for the good of Mama Liberia. There will be food, drinks, and the latest Liberian music. Can I get an amen? They've got a cover charge to that. There is a cover charge, and I believe that cover charge runs, I don't want to speak in turn, but I believe that cover charge is somewhere around $50. Yeah. So that's what I was told. It's $50. So let's remember to get these, if you can. Once we leave here, once we adjourn here, make your way there, and we'll go from there. Thank you very much. After all, do you want to resume your civics and history class now? No!
The prof is here. He don't want to lecture all I get away, but these are hard questions that we'll have to ask ourselves, and honestly, just so. We want to, again, we still waiting to get Q.
I'm pleased to announce the arrival of the President of the Republic of Liberia.
Shall end as we began by saying thank you. For those of you who have come from as far as Australia, across the continent of Europe, Canada, across 47 states within these United States, from Monrovia, from Manga, from Zwedru, from across the branch of our executive, from the national legislature, you have assembled. Thank you. Thank you, thank you, thank you. A few of us have been the faces of this conference, but believe me when I say, there are many other foot soldiers that made this happen. To those persons whose names will never be mentioned, thank you. Thank you. For those of you who had no respect for the time difference and dialed me whenever you felt like. As of 7 p.m. tomorrow, that privilege is over. Mr. President, Madam First Lady, thank you for the support that you have given us. This indeed has been a labor of love. Babe, you're gonna have me back as of tomorrow evening. My wife said to me, "You've always been looking for work." You got it down. But in all honesty, I will do it again. Because what this has taught me, whether you have that sense within you or not, there is certain synergy that we experience in this room over these days that speaks to unity, to purpose, to moving forward, understanding that this great land of liberty, all of us must be able, from the top of Mount Walagisi to Mount Nima, from the depths of Suniwe to the shanty towns of West Point, we must hoist that flag that says, "The Lone Star forever." Today, tomorrow, and the years to come. Because those who are looking down below, those who died senselessly, must realize and say to us, we did not die in vain. And those yet unborn that will walk the streets of Monrovia or Buchanan or in the little town of Folksville. Pro Temp is happy when I say that. Those who yet unborn, when they walk on those streets, may they say that those who went before us set in motion a land where there would be no more segregation, no more tribalism, no more division. For indeed, united we stand to forge ahead. Let this be the guiding principle that we leave this place with. Let us go not unpacking the short time we had, but let us say that together we came under the leadership of His Excellency, moving this country forward, politics aside. Because indeed, with God above, our rights to prove, we will. Thank you for allowing me, Honorable Erasmus Williams, for entrusting me and my committee to serve your office. Thank you, my brother. And so I invite the head of the Office of Diaspora Affairs, House, and the Office of the Ministry of State for Presidential Affairs, Republic of Liberia, the Honorable, he almost sent me crazy, but the Honorable Erasmus Williams. He will come with his closing remarks, after which I will come and present to you His Excellency, President Joseph Boyka.
We I can go to church, we feel like we're in church, you know. But very done. Very done. Thank you. Thank you. What we did it for country. We did it for the future. We did it for the generation that are here and the generation to come. We did it to pave the way, to set the foundation. Like I always believe, success comes with the first step. If you miss the first step, you'll live forever in the correct. And we've set a foundation that will lay the ground for how the diaspora will be engaged. And I say thank you so much for this opportunity. I want to call up all of our volunteers, please. Again, I want to call up all our volunteers. Our volunteers, please. Please give it up for them. Please get the volunteer from the gate. Please give it up for them, please. Because our Uber, we are credit eater. We just eating the people credit. I didn't want to know the work. The volunteers, please. You know yourself. You know you are working. You know you volunteer. Just come on. You've done it. You did it. You made it happen. I want to call up all of our volunteers so we can motivate the people to continue to get more support. But my dear, you're not volunteer. Okay, you committee member. What is the difference between volunteer and committee member? Give it up for them, people. Where are our embassy staff? Where is our embassy staff? They are also volunteers. Wow. 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 Where we done? Please come. Oh, but we say volunteer, where am I here, Wendy? Mr. Wendy, you not here? Oh, like you get big volunteer, small volunteer? All I are working for free. My people, to deal with us in our easy. I was telling the ambassador Conte, you want to share the joke? So Ambassador Conte said, Erasmus, I hear oh. I said, oh, you hear? He said, what do you mean? I said, okay. Then he said, Erasmus, I'm going to go get something from T-Mobile. I said, oh, you going to go get something from T-Mobile? There are certain unique things that make us Liberians. And we were just capturing the moment we were having that conversation, and I kept repeating it, and I just saw it across. Somebody would tell you, say, oh, my man, I hear, oh, my man, you hear? But time is fast spent. Robina, what you hear? People, you can't, man. You don't put me in trouble. Thank God I call me. I say, oh, I was volunteer. Because yesterday, last night, Georgette, Where you at? Jackie Mackie, where you at? I won't get in trouble. Ha. Before we call you, you start blacking our number because we get the diaspora annual return. In December, we'll go in Liberia, we'll come and pay you again. So, hey, protocol, I beg you, please. I want to legal. That all our volunteers there. Okay, people. Thank you. Thank you. The work you've done, this is the result. And in December, we'll actually be reviewing all of the recommendations from this conference. So we'll be doing a review in Liberia doing the annual return. So we'll come back together again to listen and look at everything you said, the different surveys, from the reports from the different breakout sections, to be able to put the document policy, we call it the diaspora policy, to share it with the government of Liberia so that they can be informed and what your high priorities are and see how they can be able to engage Liberians. So I want to say thank you, and I want to beg the indulgence of His Excellency and the First Lady, the Protein, and in fact maybe the Cabinet, to honor our distinguished free workers. But so we can take a picture together that will go in the history of this new day in the engagement with Liberians in the No, remain where you are. Please remain where you are.
You got it? You can move it. I want that.
So first, where is Ambassador Don? Can I hear our show?
Thank you, great volunteers. If you found a black purse with white charger, it was on the 14th floor, please give it to one of our volunteers. Okay, thank you so much. I think when one tax finishes, it opens doors for another one. Can you please show the, I'd like to call on Dr. Clarice Kula, please. Dr. Kula. So, Dr. Kula is leading the effort for the diaspora annual return this December. It is no here. She's not getting paid, just so you know. I can just give her headache. But I know you've been seeing this flag show. That was our diaspora annual return 2024. The video you've been seeing, the flag show, those are just the activities from last December. With the turnout and the momentum and enthusiasm we got in this room today, I know that December will even have more people. So we want to take this time to invite you to Liberia this December, where we'll be also reviewing the outcome from here, the different recommendations. We can be able to turn that into a policy document that will guide the government on how to engage us. Without further ado, I will ask Dr. Clarice Kula to use it. Please play the annual return video. And Dr. Clarice Kula will be leading her co-chair will be Tiana Kesali. Is she here? Tiana Kesali? Okay. We'll send the announcement out just a little bit. Please play the video. And we'll be very brief. Paul, Ali, where you been? Just. And I know some of you are asking how we can be a part. First, we have a global chat room. We'll make a QR code and you can just take it directly into that group that will put down to. I know while we wait for that, we also have the citizenship for African Americans that we're doing in December as well. We have a lot of other missions that come to Liberia for different purposes, and we support that as well. So,
or Philly, maybe even DC. Your heart's been in Liberia. Come feel the backroom magic, pepper soup heat, Broad Street hustle. This December, base. Whether you're in Atlanta, Minnesota, or Philly, maybe even DC. Your heart's been in Liberia. Come feel the backroom.
Technology people.
This December, it's time to return to base. Whether you're in Atlanta, Minnesota, or Philly, maybe even DC, Your heart's been in Liberia. Come feel the back home magic, pepper soup heat, Broad Street hustle, and Morovia Christmas enjoyment. The second annual Diaspora Annual Return is your call back to Liberia, your homeland. It's an initiative of the diaspora offices at the Ministry of State for Presidential Affairs and the Ministry of Foreign Affairs in collaboration with the International Organization for Migration and the African Development Bank. Make memories at the One Liberia March, Diaspora Heritage Awards, Christmas Cantata, and One Liberia Dialogue. And this year, history is calling. Join the Pathway to Citizenship ceremony as Liberia opens its doors to dual identity and belonging. Your family born outside of Liberia will now be able to continue your legacy. Don't miss out. Explore Cape Bounce beaches, swallow Donga in Bassa, and feel the mist of Patawi Waterfall. Reconnect with family, all while exploring business opportunities and having fun at music and fashion events, street festivals, and so much more. Register now. Pack your bags. The Diaspora Return 2025, the Great Reunion. See you in Liberia.
We just want to say thank you, Done, for this opportunity for gathering all of us here. And Honorable Erasmus Williams, and also to our President and First Lady. We look forward to having all of you guys in Liberia. Please join us. It's going to be an amazing time in Liberia. Thank you.
All right, well, I'll do a call on Ambassador Emerton to take it from here. Thank you so much, people. Thank you, 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 as we await more support.
Protocol has given me this distinctive privilege, and that is to introduce and present Our Excellency, the Honorable, the Ambassador, the Waymaker, the Encourager, the Father of Liberia, Uncle Joe, Bojo, Brother Joe, President Joseph Numa Waika.
Please have your seats. I think we should have done that at the beginning. We didn't do it, but I'd like for us to send a moment of silence for the loss of one of the that were behind this program, Sylvester M. Grisby, Prime Minister of State of the Presidential Event. Just a moment of silence. In the name of the Father, Son, and the Blessed Holy Spirit. Amen. To all these wonderful pro-tem ministers came all the way from Liberia, our ambassador, to the great supporters who spoke so well and inspired all of us, the organizers, all the Liberians here. You know, sometimes it's very difficult to get the Liberians together in this particular way. And I'm reminded about a young couple that were married for years, and not one day they ever went out together. But their rent was due, they couldn't pay, so they asked them to leave. And they were coming out that night. The father had a young baby, mother had a crib. for 8 years. This is the first time we're going out together. Thank you for this gathering. It's not for wedding, it's not for just Eula, the diaspora. You know, I had a lot of people talking, and I've been used from being vice president. A lot of people, investors, come in and talk, and then they remember me saying, even NATO, no action, talk only. And every time they come, they say, this is not NATO, I'm serious. But we know all the speeches we listen to here. I wasn't here for the deliberations, but I know this is serious business. And I want to thank you all for this kind of commitment. This is very historic. For the past 2 days. And don't mind Emmett Don being so excited. For too long, he owed me a diary. And just not too long ago, I told him the diary is fully paid, you're free. So he's so excited. Then I asked him to go and speak July 26th. Remember the last July 26th speaker? Yeah, we had some problems. He went this time. This time I was on me. But Emmett, we are very proud of you. Thank you so much. Thank you so much. I never had anybody going to the living room of the president every time, whether it's in the morning, in the evening. Sometimes the moment I see Erasmus, I'm almost angry. But Erasmus is a go-getter. He doesn't take no for an answer. Sometimes we need people like Erasmus. Thank you very much. And for all of you, we are said that we're here for the building of our future, for reconciliation, national healing and growth. In my remarks yesterday, we have the traditional saying that sometimes people wonder, but they couldn't understand why we had to start with reconciliation, reburial, and all of these. The traditional saying that they don't have them anymore, maybe they do. That when the lice is in the head, if you don't take the lice out first, you plait it, you will loosen it again. Because you'll be scratching on it. And so we have to do that. So we are closing the first annual diaspora conference here in Washington, D.C. And I'm filled with gratitude, renewed confidence, and hope for Liberia's future. I think one of the things that people have been accustomed to is that I never was concerned about presidency. It's about leadership that will transform our country. And that's why when I was vice president in 2015, I just got up in the morning and I wrote something, think Liberia, love Liberia, and build Liberia. So when I made the first Christmas card, I had Liberia is 168 years old. Let's ask ourselves, should be. Are we satisfied with where we are? From now on, think Liberia, love Liberia. And that has been part of it. Today I hear people call, oh, thank you for our country. I never used to hear that before. But we're getting there. I know you can see people smiling, people who had this grief that have been carrying for years. And we see the country is moving. I don't even listen to the criticism because I always say, don't cause the darkness, turn the light on. That's all we're doing, turning the light on. Forget about the darkness. At least the Zocos are blaming me. I don't give them any more chance to check people's phone because they have electricity. But to all Liberians, both at home and in the diaspora, I want to thank you for your passion and the contribution. The chairman and members, the planning committee, your tireless efforts, you're turning the vision into reality. The coordinator, the diaspora office, I want to thank you for your leadership, your coordination. We deeply appreciate your partnership, all of your sponsors, your support, and the demonstration that you're fit in Liberia's journey. I don't care what you say. Liberia has always been a friendly country. I mean, the thing about Liberia is not the resources, it's the people. Friendly people. This one African country with all of what has happened, never been a time when here Liberia deported people en masse. I never heard it. When the war took place, I went to Sierra Leone, and the people said, we didn't understand why you should be army. Because if we wanted to go to the United States, we couldn't go. We came to Monrovia. Maybe we didn't know what we had, and that's part of it. This conference has reaffirmed the truth that Liberia cannot build itself with a future in isolation. I always tell people you can pawn Liberia, you can't sell it. It will always be there. And our government is committed to people you see around here. I know, as far as the public knows, every government official is corrupt. But all of them, we are very proud of the people that we've been able to appoint at the highest level. We may have inherited so much. Maybe most of you don't even know 10% of what we inherited. But it doesn't matter. Our job is to make sure that Liberia, you knew just a few years ago, you would never see it. It's going to move to a better For those of you who have worked, we'll review all the various recommendations and action. Under the arrest agenda, we talk about agriculture, roads, rule of law, education, sanitation, tourism, and technology. We are creating investment. And I'm happy that this conference won't take too long. We have plenty of land, we have plenty of opportunity. We'd always said, when the Liberians can be responsible for the rebuilding of their country. To our brothers and sisters in the diaspora, we need your skills. I said yesterday that yes, we got your remittances, but that was giving people fish. You need to teach us to fish. We need you. Together, we can turn all the remittances into factories, into scholarships, into clinics, startup, transforming private service, and sacrificing to public good. So as we look ahead, the government of Liberia pledges to keep the dollar alive, and we will institutionalize the diaspora engagement as a pillar of our national development. We will work with you to build a transparent system, protect investments, and ensure that your contribution yield real result for our country people. I know it has shown amount, but I heard the celebration of worldwide. So I want for us to leave this conference not only inspired, unique in purpose, and determined to build a Liberia where healing leads to growth and growth leads to shared prosperity. The future is ours to create. We have a lot of good in that country, and it will take Liberians to make it happen. Doesn't matter how you came here. It was time to come. This is the time to look back. So I want to thank you all, and I want for all of us to continue in all we do to think Liberia, love Liberia, and together build Liberia. Having said this, as we've been here already for far too long, I just want to say to you that on the follow-up, we intend to set up a diaspora commission that will institutionalize the diaspora. We'll be going home. I know the legislators will have a part to play, and the names of those who will comprise that will have to be, it's not something I would just sit and write, but it has to be something that all of us will contribute to. This is a small beginning, but I know Liberians, when you say you will do it, you will do it. And you're going to do it. So thank you very much, and to all of us, our partners in particular, for coming to our call, speaking so eloquently and contributing. The more we do it for ourselves, the more you will see other people coming. And I can assure you, between now and the next 3 years, all of you want to go to Liberia. I can tell you. You want to go to the southeast, want to go to Lofa. I haven't been to Lofa for a while myself, but I can assure you, Liberia is on the move and nobody can stop it. Thank you very much. God bless you.
nobody can stop it. I say your time, nobody can stop it. They can do what they do, and they can talk what they talk. They can do what they do. Hey, tell the fight.
You put that on. You just ran that way.
I say your time, nobody can stop it. I say your time, nobody can stop it. I say a jumbo, now when you think about me, a jumbo. All I do is win, 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 win. All I do is win, 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 win. Born to win. I say I was born to win. Born to win. I say you were born to win, yeah. Born to win. I say I was born to win.
Exclusive. LIBERIA.com. Begin at LIBERIA.com.
fast. Camera rolling. Oh, okay. Thank you very much. And come to you, Mr. Nathaniel, Honorable Nathaniel Kwabo. Welcome to the Liberian Television Network.
Thank you. It's a pleasure.
We're here for this all-important 3 days conference. Just concluded day 2. We just listened to the president spoke so eloquently, so passionately. Let me just ask you an overview of the entire event, the entire conference. What do you think about this?
I think it was fantastic. The objectives of the conference were achieved, as far as I know. This has been long coming. Way back in 2022, the president had a conversation about how he could engage the diaspora if he had an opportunity to become president. And by 2023, after elections, he had come to full circle in terms of his vision for the diaspora community involvement with development back at home. And so, we went into motion, working with the Diaspora Office and Ambassador Dunn and others to ensure that, this happened. And thankfully, it happened and it has been successful so far.
Thank you very much. And let me go to my colleagues if you have any additional questions.
Yeah,
go ahead.
Minister Kwabo, you told us about you mentioned objectives and the goal of the conference. Can you elaborate? What were the goals of this?
Yeah, right now, for you. Grab all of that.
the other side. Let me see. Somebody come and tell us. Oh, they went back off.
For change in Liberia. You know, throughout the conflict period, through our crisis, the diaspora voice have been prominent. And as a matter of fact, in the resolution of the crisis in Liberia, they were also prominent. And as you know, I was executive director of TRC, and I remember us having some of the hearings here in the U.S. with the diaspora community, and it turned out to be a very big success because, you know, many of them fled country, not voluntarily, but because of the crisis in the war. And so we felt, you know, their perspective, you know, will be essential in terms of how we resolve the conflict. So, you know, the diaspora community has been key. And so the objective was to engage them, you know, as we turned a new page for our country after war, you know, because we know how much they can offer, you know, in terms of how we can change, you know, using the overused word, trajectory of our country. And I think we are heading there.
Thank you very much. And the president spoke about, in his speech, he made a statement that the diaspora will be a pillar for the national, or is a pillar for the national development. He also made another statement. He said he want to set up a diaspora commission. I want to ask you what you think about that, and also there are some Liberians that are also pushing for Liberians to be able to have more involvement in Liberia by participating in the elections. So what do you think about the president proclamation by having a diaspora commission, and what do you think about Liberians participating in the elections in Liberia?
I think it's a testament to how much he wants the diaspora to be involved in the development of the country. So it's not just a diaspora office, he's elevated to a commission, you know, which means that he's taking it very seriously. And therefore there will be a team of men and women to focus keenly on diaspora affairs, because we think as a pillar to development, we couldn't have done any better than to create a commission, because a commission is the highest level that you can reach when it comes to this thing. So I agree with him that a commission should be established.
And let's dig a little deeper. I want to dig a little deeper into the conference itself, and in terms of programs that the government expects out of the diaspora. But I mean, you have followed, you've been part of this process. What are the tangible things that you observe out of this conference that you think are implementable and that the government can complement to make sure that the overarching goals of the conference are accomplished?
I think some of the recommendations that we made, you know, let's start with reconciliation. You know, it is clear that the folks here in the diaspora believe that we need to reconcile our country, and they have clear ideas in terms of how we approach it. Unfortunately, most of the things that have come out, you know, to propose are all in the TRC recommendations, and so there's a synergy between their thought process and government action. So I think it is one of the things that we can quickly, you know, one of the low-hanging fruits that we can deal with. As you know, the president is already implementing several TRC recommendations. The offer of state apology, he has clearly given the instructions to begin to look at the rewriting of Liberian history to reflect the mosaic that is Liberia, to make it more inclusive. It is one of those things. He has also gone ahead, you know, to give dignified burial to two of the heads of states that were brutally murdered. And so, you know, the aspect of reconciliation is something that the president, you know, is on and can easily, you know, be carried out or implemented. The second thing too is the need to create the propitious environment in Liberia to attract the diasporian community in terms of investments. Okay, so it's a key proposal. The president is willing to create an enabling environment, you know, for the diaspora community to be free at home and invest. And, you know, in his speech yesterday, he said it's a two-way street. You know, why we want the diaspora community to be engaged in Liberia. We also think that we needed to create the conditions for the security, for the utilities, and all that, to ensure that when they come back home, they are okay. Including healthcare. Because one of the things that I thought, when I come home, how do I, what service do we have, health service do we have that can take care of me, and when I leave the U.S. Because what we have here is some of the best you can find around the world. So living this year, especially those who have, serious ailments, going to Liberia to settle, the thing is, the uncertainty about how they survive their ailments in Liberia is something that they are concerned about. So, building the health sector and providing, better health services is some of the things that, the president is looking at. And I think, in the next couple of years, we can reach an optimal level where people will be comfortable with the health service in Liberia.
Thank you very much. I would love to obviously ask you more questions on this conference and other issues that you've answered on. But again, I will extend an invitation to the network. We have other interviews lined up. So I'm going to give you the opportunity to give us your final words, and then we'll bid you close the interview.
On the question of elections, a long time, but we have to put in place systems and securities so that it will not be abused, the opportunity will not be abused. But we know Liberians didn't come here, many of them didn't come here voluntarily, they were forced out. And therefore, they must have a voice in how we choose our leaders in the country. And so, I support that, the president supports that, and it's something that we're going to look at. And luckily for us, the President Pro Tem, clearly stated in a comments or statement yesterday that will provide the opportunity for Liberians to be able to vote while in the diaspora. But again, we have to build a foolproof system, so that people will not abuse it.
Thank you.
And I think the president of EULA, speaking yesterday on the reconciliation panel, also kind of made a commitment, but also a call on Liberians in the diaspora that they can also contribute financially to that process. So I think that's one place where the government and the diaspora can collaborate to make sure that is accomplished.
Absolutely.
Yeah.
Thank you very much. Again, this is the end of this interview. It was nice speaking with you. We'll take a very short break. When we'll come back, we'll bring you more interviews.
Attention all organizations, NGOs, and social clubs in and out of Liberia. Are you tired of relying solely on social media to run your operations? An effective web platform is your most important marketing tool. And that's where Tiamet.com comes in. Hello, my Liberian people. My name is Sophia, and I want you to consider this. 53% of consumers do online research about an organization before talking to someone from that institution. That means not having a website could be costing you opportunities. Step up your game and establish a professional online presence. Introducing our web platform, designed specifically for 501c organizations, small businesses, and political organizations, social clubs, etc. Tiamet.com, we understand how important it is to make a great digital first impression, which is why we offer you all the help needed to develop, maintain, and host NGOs and small and big organization websites by giving you a full suite of services that includes automatic billing for members, membership and visitor portals, first-class design and functionality, and much more. The best part is, it only costs $20 per month. Upgrade your image today with our customized web design services. Visit www.tiamet.com to get started. This is a Liberian-owned business.
Maintaining your vehicle can be a major investment. That's why here at Brothers Auto Care, we pride ourselves on providing professional and reliable auto care at affordable rates. Whether you need an inspection, new brakes, or diagnostic reports, our skillful and experienced mechanics are here for you every step of the way. Call Brothers Auto Care now to schedule your next auto maintenance and repair service. At Brothers Auto Care, we help you drive home with peace of mind.
Okay,
Yeah, we'll wait out there.
We're bringing the pediatric sector and the elderly community under one roof. We are building a pediatric health system for children, never been done before in Liberia. We are also building an elderly community where we can host Liberians, not only from the United States, but also from Liberia, who can receive the medical care that they need. So the name of our organization is ACAN, which is the elderly part of my organization, and the Robert A. Pritchett, which is Natalie organization, coming under one roof, and it's called ACAN Robert A. Pritchett Generation Medical. Why she decided to merge and do this?
Yeah, please do talk to us.
I'll tell my why. Actually, I decided because I visited Liberia 3.5 years ago, and one thing that struck me was the disparity of care. You know, they showed me some places that were like, that's a clinic, that's a hospital, and I was like, wow, this is why people are dying. So I have the Robert A. Pritchett Stroke and Health Initiative. Healthcare means a lot to me. My son had a stroke at the age of 22, and you know, that changed my life. And you know, so it was just one of those things that just happened. And had it not been for community, you know, people, I don't know where I would be. So Lois here, we've been friends since we were 13 years old. 13 years old.
From New Jersey.
We grew up together.
Yes.
So my son is her son. So, and she's on my board. So she, you know, she, you know, throughout the years, everything that we have done with the foundation, and I was looking to go into Liberia to see what it is to help the people of Liberia. So she, you know, she brought the idea that, hey, Nat, let's see what we can do together. Okay? So that's how we decided to come together. I'm established here in the U.S. I'm in Georgia, and I have a platform that basically national because of my son, you know, what happened to my son and us in the community and the people, and basically, you know, I was like, sure, let's get together and see what it is that we can do. I was looking to do something in Liberia and do something with someone that I can trust to make sure that we get done what we need to get done. So of course, you know, she was like, we're going to build a pediatric children's hospital with the elderly care. And what better way than the elderly and the children? Even, you know, when an elderly person is sick and you put a child in their hands, they get that joy. So just having the two together, I think it's going to be I know that it's going to be a great thing.
I think it's a great idea, especially taking this to help people in Liberia.
Yes.
Here's what I'm going to ask now. A lot of people will watch this and will say, oh, that's such a great initiative. Now, how can people reach out to you if they want to collaborate or if they want to help? And my last question, because I don't want to hold you guys here too long. Okay. How is this diaspora conference going to help this initiative that you guys have?
Okay. Well, I want people to know that we are building hope and we're healing generation. We're not just building a building. You know what I'm saying? Like the president said today, you want to make an impact, you want to make a difference, you can't do that in the United States. Our children need us. The future of Liberia are those children that we're taking care of now. It's not just education, but also the health. We don't have preventive health care in Liberia. Children miss schools because of simple things like cold, you know, just little things that can be done on preventive measure so they do not have to get to the point where they have to miss school. We want to make sure, so we cases. Maybe an ER room, or I want to sponsor a vehicle.
Is there a website that they can reach out to?
Yes, there is.
Yes, so is this, so I can just read it out. And
yes.
Then,
the website is
this one right here?
Yes, that's the website on the, yes.
All right, thank you guys so much. Again, guys, if you're listening, the website to reach her is aachenpitchardhealth.org. Again, I'll read it. aachenpitchardhealth.org. We will post this on our website so you have all of the information you need to read more about this initiative and contact them. All of the information you need to read more about this initiative and contact them if you need to or if you want to. But again, it's been very nice talking to you guys.
It has been. Thank you for having us. We appreciate
Thank you.
Thank you so
Thank
much.
you for
and we're looking forward to our building in Liberia. We're excited.
Thank you guys. This is LRTN. We'll take a break and we'll come back. We'll bring you another interview.
Thanks, guys. We appreciate you.
Bro, take a commercial break. Put the break on. Is it still on?
Yeah. You got somebody else?
No, we got you. How are you again?
I'm good, sir.
You remind me of the name. I'm sorry, because when I get on,
Francis Menza.
Francis Menza.
President.
The last name is a Ghanaian name?
A Liberian man.
Is a Liberian?
Yeah, I'm a Liberian.
I know you're a Liberian. I have a Ghanaian last name. I'm a Liberian. Born Liberian.
Yeah, it should be Ghanaian name.
It should be Ghanaian, yeah.
Okay.
The Francis Menza, right?
Yeah.
CISE?
Yeah, CRS, Francis. FRANCRS. CRS.
CIS, right.
CRS. And
President of the Liberian community on that list.
no, we got me get a name good so you get it.
Francis.
Yeah,
My hand, Francis.
Yeah, but you got space. So you get it correct. Right here, so you know, yeah, because people can a little bit long. You.
Welcome back, ladies and gentlemen. And as promised, we'll keep bringing you more interviews until we finally conclude the 2 of 3 of this Liberian Liberian Diaspora Annual Conference organized by the government of Liberia in collaboration with the Liberian organization here in the diaspora. We have with us now Mr. Francis Mensah, the European Federation of Liberian Association President. Liberia Television Network.
Thank you, sir.
Now for this conference, and you spoke yesterday so eloquently. And I would just like to ask you, what do you think about this conference? I know you made a later on, but what do you think about the conference overall?
You know, first of all, I want to extend thanks and appreciation. Dr. Don and his team. It was beautifully executed. It's very important for Liberians to come together from across the world to come and relevant to the growth and prosperity of the country. So I think that's a good initiative, and I'm impressed. So on average, I think it was good.
Thank you. Yesterday you spoke about the need for Liberian in Europe or in your
Scandinavia.
In Scandinavia to be fully represented by a consulate.
Yeah.
Can you talk to us more about that?
Yeah, it has been a little bit a challenge over the years. Prior to the war, we had an embassy there, and then in Sweden, Norway, and the kind of Scandinavian countries. So since post-war, we have been struggling with representation in terms of having a consulate on the ground. Although we have an embassy that is responsible for the Nordic countries and embassies in Berlin, Bonn, Liberian embassy. But Liberians in Sweden, in Norway, Denmark, Finland, have over the years been struggling to obtain visa renewal, passports. It takes time to go to Germany. You use secure service, DHL, FedEx, or UPS, whatever. You send your passport. Sometimes there are delays, and people who are urgent matters, to go to Liberia. So that's the reason why we are advocating that we have a consulate, an office in the Scandinavia, Sweden, because it's easy to commute. Either take the train from Denmark or to Stockholm, Norway, Finland, just like that. So that's the reason why we are advocating on behalf of our people. And it is good to mention that the UN repatriated or resettled upwards of 2,000-3,000 Liberians in Scandinavia, like Norway, Sweden, Finland. So there is a huge population of Liberians in the Scandinavia.
I know. Thank you very much. I know you've been engaging with representation from the Liberian government, maybe the president of Liberia, on the request you just made. And the president, you listened to the president today. He said he wants for the diaspora, or the diaspora is a pillar for national development. Also, to set up a diaspora commission. Is that commission, to your knowledge, going to include your territory as far as the people you represent?
Well, obviously, it's our expectations and our hope that with the setting of that commission, it will cover the entire diaspora, and my region is part of the diaspora. It's a microcosm of the diaspora, so we expect to have some leverage, in terms of how they will go about constructing that. How you call it? What's the word again? Diaspora commission. Yes. So yeah.
All right, thank you so much. I don't want to hold you too long. This is the Liberian Television Network. We're in office for Philadelphia, so we'll reach out and send you an invitation to come on one of our shows and talk more about this. But for now, thank you so much for showing up. I'll give you the opportunity. If you have any final words, you can do so right now.
Well, definitely. No, we came to honor the invitation by the president, from the president of the Republic of Liberia to his intermediate, his people he has official who organizes conference. I want to extend our heartfelt thanks and appreciation to them again for such a wonderful conference, and we look forward to more engagement. We have a lot of things to discuss as relates to the diaspora, especially from the European perspective. We think that we need to extend it. America is not only the diaspora. Europe is a part of the diaspora. In fact, Europe should be the second largest Liberian diaspora community. So we look forward to more engagement with the government. So thank you for the opportunity, and good job.
Absolutely. It was nice speaking with you. Guys, this is the Liberian Television Network. We'll take a break and then bring you another interview after. Thank you again.
Did you know 1 in 4 patients who take opioids long-term become addicted? Opioids are strong pain medications like oxycodone, hydrocodone, or morphine. They can help with pain, but they can also lead to addiction and overdose. Take the medication only the way your doctor tells you to take it. And never share them with your family, friends, or neighbors. Know the risks. Stay safe. This message is brought to you by the Multicultural Community Family Services in partnership with LRTN. In our community, we help each other. But when it comes to prescription pain medication, such as opioids, sharing isn't helping, it's harming. What works for you could be dangerous, even deadly for somebody else. Don't share your opioids. Instead, help by guiding your family, friends, and neighbors to a doctor. Real help saves lives. This message is brought to you by the Multicultural Community Family Services in partnership with LRTN.
Welcome back, ladies and gentlemen. We're almost at the very end of this, of day 2 of the Liberian Diaspora Conference. We'll just bring you 2 more interviews. Right now on our camera, we have with us the CEO of Too Easy. So
yes,
welcome to the Liberian Television Network.
Thank you so
much.
Please
talk to us about, just introduce yourself, we'll get into your brand.
Okay, my name is Jack. I'm running a clothing brand, a streetwear fashion brand called Too Easy, where I've been around for 2 years. Happily, we are in the United States family and seeing how we can expand as much as possible.
Thank you very much. You're here at this this conference, and what is your goal or what is your purpose here as far as engagement? I understand the president or convene this in conference for Liberians to engage with the government. So what is your goal? What do you think the outcome of this as far as your brand is concerned?
It has been really good. First and first, the opportunity itself is a big one for us to be able to come, and because the goal is to be able to expand as much as possible from one country to the next. And US has been on the list for a long time because of how much Liberians here have always wanted to experience Too Easy. And now we have been able to meet a lot of stakeholders. We're in the fashion industry here in the US. We have been able to make a lot of connections, talk to people. And beyond that, which is the most important part, is people actually love what they see because it's a success story. And now they get to experience the actual Too Easy in person. So it's a very good thing. We've been having some real fun.
That's good to hear, and the positive feedback and the experience.
Yeah.
Now, this is the LIBERIA Television Network. I really wish we had more time to talk because I would like to talk more about your brand.
Yeah.
But I'll just give you the final minutes now to just talk. Give us any final words and give you an invitation to come back to the network, and then we can talk more about your brand.
All right, so as part of what we do, we got planned for this trip because I'm here until the 10th. Is we will do a pop-up in Philly on the 5th, and that will be our first major activation here in the US. And then hopefully next year we can be able to do a lot of other activations from one state to the next, which will include Minnesota, Fargo, Atlanta, and you just name it. So we'll do a lot of other places, and we're looking to collaborate. We are just open to collaborating with a lot of friends here in the US.
Okay, thank you so much. This is our network. We're hoping to you. Again,
you so much.
It's been a pleasure. Guys, we have our next interview coming up, so stay with us. We will take a break, and when we come back, we will bring you our final interview.
All right.
The microphone line, the camera over there.
All right, cool.
Welcome back, ladies and gentlemen. This is the Liberia Radio and Television Network. We've been bringing you live coverage of the Liberia Diaspora Annual Conference organized by the government of Liberia in collaboration with Liberians here in the diaspora. So we have one more interview to bring you, and then we'll call away. We will conclude this coverage and then resume tomorrow. We have with us here an entrepreneur, a promoter, J-Base on our camera. Welcome to the LIBERIA and Television.
Thank you, my brother. Thank you for having me.
It's a pleasure. It's been today is day 2 of this more important conference. You've been here, so just talk to us of your. What do you think about it? The government of Liberia reaching out for diaspora Liberia to engage with the government. What do you think about that?
So definitely the government, the first step they took to kind of initiate this kind of program to try to figure out how to bridge the gap between us over here and them, to let us know it's okay for us to come back home and they figure out how to secure our investment. But I'm thinking to myself, this is a dope idea, but I feel like grassroots has to be done first before we can start talking about money. Yeah, because the money, I feel like when it comes to money, right, a lot of people understand the power of money. Money is a tool. Money is not what gets things done. It's what starts things, but it's not the end goal to getting things done.
So what would be your recommendation to the president of Liberia in addition to him just doing this?
I feel like President of Liberia needs to start to figure how to do things in Liberia, right? Figure out how to create a structure where the people, the citizens of Liberia understand what business is. Because a lot of people in Liberia, they don't know what business is. Business is a growing process. It's something that you start today and you look to gain profit in few years. Every business has a plan. Every business has the turnaround time on where whosoever that start that business, when they can be able to gain from that business. So I think we need to start teaching the people of Liberia these rules and regulations before you have investors come in and bring money into the country and it turn out to be like a loss situation for them.
Thank you. Now I want to draw your attention to something the president spoke about and how we can tie that in with what you do as an entrepreneur, as a promoter. He said diaspora is a pillar for development, for national development, and he said he also want to set up a diaspora commission in your discipline as a promoter, as an entrepreneur, and all the other things you do. How do you think that can tie in? How can the government help you, and how can you help the government?
So I feel like for me, looking at what's going on right now with the government, right? The government need to connect with the rightful people, right? They need to come on ground and get to understand who actually could help this process, right? Not just come up with an idea and think anybody could work this plan. So I feel like the Liberian government need to come to the drawing board and have information on who actually can help create a system that can bridge the gap to actually bring results, because we need results in our country.
We definitely do. I can agree with that. Now, I don't want to hold you here too much. We're already fast approaching the time we're supposed to be out of here. But I'll ask you two more questions. And there are some Liberians that just stay on the other side of things and be the way I've been here. I've seen it before. This is just talk. Nothing going to come out of it. Other administration has done. So where do you stand as far as that is concerned?
So me as a Liberian, I feel like we are the government. Every Liberian is the government of Liberia. So it lasts for us. There's nobody because you think about Liberian government, like we say, oh, their government didn't do it. Then you take another group of people, put in there. They say, oh, we are the government. So we got to blame ourselves for everything that happened in Liberia. We got to go back home. We are, as Liberians that live in America, we need to take all this information that God bless us to leave that country and come here and learn and take it back home. That's what everybody else do. That's what Nigerians do, Ghanaians do. They get information, they go back home and they take it and they create a system and they build their country. So we need to go back home as Liberians and stop blaming everybody else for the reason why. It's like, for example, right, if you got a child, right, and your child leave home, you as a parent, and you'll tell your child to come home?
Yes.
Yeah, so we need to go home to clean up the house. If your house dirty and your child leave the house, your child go walk up or go play outside, and you'll call your child to come home and clean our house for that house to be presentable.
Right.
So we need to go back home to Liberia in order for Liberia to move forward and take everything we have learned from this great America.
Thank you very much, J-Base. We are a neighboring network. You know of us very well, so we'd like to build up on this conversation, but obviously we can do it now. So I'll give you the remaining time to just give up any final word you have.
Thank you, definitely. So this is a great event. Thanks to the Liberian government for initiating this event and starting something that we, I'm talking to all the young Liberians out there. You need to be a part of these things, right? You need to be in these different rooms, these different spaces, so people can know that we serious. And one thing about Liberia that I've seen have changed is the Liberians that never been to Liberia, that wasn't born in Liberia, that born in America, they want the Liberian culture now. They proud to be Liberians. So we as Liberians need to understand we are moving forward, and things will get better one day for our people.
Thank you very much, J-Base, for speaking with me.
Thank you for having me.
And guys, if you're watching us, this is how we'd like to conclude this day 2 of the coverage of the Liberian Annual Diaspora Conference convened by the President of Liberia. This is the Liberia Radio and Television Network. Continue to follow us on Facebook at LIRTN.live, on YouTube, the Liberia Radio and Television Network. We will continue to bring you coverage here in the diaspora, and we have our office open in Liberia as well. So please make sure you are following us on all of those platforms. My name is Derek Yale. Until next time, I bid you all a pleasant good evening.
Attention all organizations, NGOs, and social clubs in and out of Liberia. Are you tired of relying solely on social media to run your operations? An effective web platform is your most important marketing tool, and that's where Tiamat.com comes in. Hello, my Liberian people. My name is Sophia, and I want you to consider this. 53% of consumers do online research about an organization before talking to someone from that institution. That means not having a website could be costing you opportunities. Step up your game and establish a professional online presence. Introducing our web platform, designed specifically for 501c organizations, small businesses, and political organizations, social clubs, etc. At Tiamat.com, we understand how important it is to make a great digital first impression, which is why we offer you all the help needed to develop, maintain, and host NGOs and small and big organization websites by giving you a full suite of services that includes automatic billing for members, membership and visitor portals, first-class design and functionality, and much more. The best part is, It only costs $20 per month. Upgrade your image today with our customized web design services. Visit www.tiamit.com to get started. This is a Liberian-owned business.